Yeah.
All right, good morning, everyone. Welcome to the February 22nd, 2023 Early Learning Council meeting. We appreciate you being with us, council members, and also people from our communities and other staff members. So Remy, will you please call the roll?
Yes. Okay. Here we go. Andrea Bell is excused today due to legislative session, which I should preface, several of our agency leads are going to be excused from legislative session. Angie Blackwell.
I am here.
Katie Brooks is excused.
Yes.
Peter Buckley.
Here.
Excellent. Ben Cannon, the director of the Higher Education Coordinating Commission.
Yeah, I'm here and I'll be joining them by video shortly.
Thank you, Ben. Alyssa Chatterjee, the director, the Early Learning System Director of the Early Learning Commission.
Here.
Wonderful. Colt Gill, the Deputy Superintendent of the Oregon Department of Education, is excused for legislative session today. Ann Kubish.
Here.
Thank you. Khalithorn Ladd.
Present.
George Mendoza.
I'm here. Hello.
Hello. Dr. Peg Miller.
I'm here.
Thank you. Subin O.
Here.
We have Ashley Thirstup here for James Schroeder, the interim director of the Oregon Health Authority.
Here.
Thank you. Lisa Wendt, the deputy director of the Oregon Department of Human Services, is excused for legislative session. And I believe that's it. We have a quorum.
All right. Thank you, Remy. And at the beginning of our meeting, I want to invite Alyssa Chatterjee to introduce two new staff members at the ELD/DELC.
Thank you. So good morning, and your time is perfect.
Can we do a quick check-in with the folks on screen? Can you hear us? Okay. Yeah, awesome. Thank you.
You want to approach the table?
Good morning, everyone. Serena Stoudemire, Wesley, Deputy Director and Chief of Programs for Early Learning. Thanks for having me this morning.
Thank you for joining the team.
You're welcome.
Serena.
All right. Good morning, everyone. I'm Cooper Brown, third day as the Chief Operating Officer for Early Learning. I'm excited to be here, excited to work with you.
Well, welcome.
Welcome
Thank you.
aboard.
Thank you.
Yeah,
Appreciate it.
we'll look forward to working with you as well.
You know.
Oh, no wonder Alyssa looks so happy this year. How many more positions to fill?
We're getting there. Getting there.
We've heard about the COO for a long time. We're really glad to see you. And so now we've worked together for a while now, so many years now.
Really, really excited. So it rounds out our executive team, which is really exciting.
Great, great. Okay, the first thing on our agenda, as you know from the packet, is to have an update on the legislative session from our agency partners. There is a lot of information in our packet, so we will have some in writing and then some will be oral. And Ben, is this good timing for you to start, or would you rather have us start with Ashley?
No, I'm happy to start. Let me just get myself
Okay.
settled here and maybe make it so you can see me from. I am not in the Capitol today, as you can tell. I'm working from home, but really happy to be joining the council this morning for what I think is my second, maybe third official meeting. But again, really appreciate getting the opportunity to work with the council and work with DELC as it develops and in support of education and training for early childhood professionals, because that is where at the Higher Education Coordinating Commission we come in.
Yeah.
I will just give a brief update. I think as council members are likely aware, the Higher Education Coordinating Commission, in partnership with staff at the soon-to-be Department of Early Learning and Care, proposed in the fall for the governor's consideration in her budget and policy priorities, the creation of, or the funding of an early, a sort of grant program for folks seeking education and training in professions related to early childhood. And so the HEC included in its agency request budget in the fall that a proposal for a just over $5 million investment in grants and scholarships, effectively non-repayable grants. So they're not loans, but grants to support professionals or folks seeking to become professionals in the early learning setting, in early learning and care settings. Very pleased to report that the governor's recommended budget, which the governor released at the end of January, included funding for that proposal, included the just north of $5 million that we had proposed in our agency request budget. So that sets it up for a presentation to the legislature, and I think a good legislative discussion about that proposal. That conversation hasn't really begun. It will be describing that program and our request for funding that program, the governor's request for funding that program, to the Legislative Ways and Means Committee during the Higher Education Coordinating Commission's testimony to that committee and a budget presentation to that committee, which will take place in April. So we're still, a few weeks away from presenting that proposal to legislators, but really excited for that. And again, really pleased and grateful that the governor saw fit to include that proposed new investment. And just by, I think just a little bit of additional context, this is a budget that I think generally for the legislature and the governor is challenging and did not create a lot of opportunities for new investments. Certainly within the post-secondary education space, there was sort of limited ability to create new investments. And so a lot of things that we had asked for are not in the governor's budget, but some really important student grant aid is, and this program included. So we're really, really pleased to see that. Council members are also likely aware that there is an accompanying proposal for a statutory change affecting the same program, again, in partnership with staff at soon-to-be DELC. I guess I don't know whether to call it the Early Learning Division or DELC, so I'm just going with DELC.
We go back and forth too, Ben.
Yeah, I'm sure. In partnership with staff, we are proposing to expand the eligible uses of this fund. So under the current law, it seems likely that it would be interpreted to apply only to adults seeking training, post-secondary education and training to become early childhood educators, to work in a classroom or care setting as the caretaker or the educator. And the intent with the legislation is to broaden that program so that it can support other professionals who work with young children. And so you can imagine, behavioral health or other forms of, social work, other forms of support that professionals provide to young children. That we had a bit of a, you'll be the first to learn publicly that we've had a bit of a snafu as of 4:51 last night, and in our attempt to introduce bills, work with DAS and the committees in a process that was new to us, to our team. And so we're having to kind of reassess how to ensure that very modest change to the law, proposed change to the law, gets in front of the committees, is presented to them in bill or amendment form. So stay tuned. I'm confident we'll find a way. It's not a big proposal, and I think we'll find a vehicle for it. But we are, as of this morning, we don't have a specific bill number to share with you and say this is the bill that would accomplish the change. And I'm happy to go into further detail if folks would like, but it just gets into the intricacies of the paperwork and the committee and deadlines and the clerk's office and DAS and paperwork.
It sounds easy.
Just new processes. So in any event, I am optimistic that we'll find a way to present that modest proposal to legislative committees, and it will be considered. And I think, generally met with support, assuming, of course, that that the council and the department, continue to feel like that is the appropriate direction to go. The final thing I'll say, just, on the 5 million, on the fund itself, I mean, we have a lot of evidence, increasing evidence as an agency that administers, hundreds of millions of dollars of state direct grant aid to low and middle income students. We have a lot of evidence about the impact that has. Partly in terms of creating access. That's, I think, how these programs are typically understood, right? A prospective student who learns that they have grant funding to defray the costs of going or earning a certificate or degree is more likely to see that as a viable path. So it certainly is doing that, but it's interestingly also in terms of their likelihood in completing their certificate and degree. And so on the Oregon Opportunity Grant, which many of these students would also be qualified for on the basis of income, and if they're in a qualifying program, which include most public and private institutions and programs in Oregon, we see modest increases in their likelihood of completing, like several percentage point over students who actually have slightly higher incomes but don't receive the grant. It's a really powerful finding about the contribution that state grant aid can make to not only opening the door, creating access, but also making it more likely that they succeed, because they're slightly less likely to be set back by the inevitable need for childcare, housing, transportation, the challenges that students and Oregonians generally face in making ends meet. So that's I think the gist of my update, but I'm happy to answer any questions.
Wow, what an exciting program, Ben. Questions, Khalid?
Yeah, it's very exciting, Ben. Thank you. Couple of questions. One, is there a communications plan to make sure people know about this opportunity? And is there any sort of strategic communications that you're hoping the council can participate in? I just want to make sure folks know.
Yeah, so if it is adopted by the legislature, which of course we hope it will be, then we will communicate through, at a minimum, our usual channels for grants and scholarships. And we have a very robust OregonStudentAid.gov, a very robust website that gets hundreds of thousands of student or prospective student users annually, and is the vehicle for Oregon students to apply for state grant aid. I think we also, as part of the proposed package, we would be adding a staff person who would be part of their responsibilities would be to communicate, especially with and through partner organizations, to prospective participants in the program. So that would be on their agenda as well. I am going to go out on a limb here and say that I should know this, but I didn't confirm it with staff before preparing for this morning, and I should have. But I will go out on a limb and say that if adopted by the legislature, we would be starting this program not for the fall of 2023, and that may be disappointing, but probably for the fall of 2024. Typically, our grant cycles for college going are kind of active right now, is when students are starting to really make plans, put their applications in, or renewal applications in for grant funding. And so we're actually making those, or starting really in March, making those awarding decisions. Of course, we're not able to do that for a program that hasn't yet been funded. So we will likely be implementing this in the second year of the biennium. While that may be disappointing for folks who want to get going now, or get going in the fall of 2023, it also gives us more time. I guess the positive side, the silver lining, is it will give us that additional year to help get the word out and ensure that we get a really diverse pool of applicants and take advantage of the funding if the legislature provides it.
Wow, Steuben?
I'm happy to hear about the grant program and how it's developing, and what you were sharing with us. I think my comment is actually more about kind of zooming out a little bit. I was so excited to learn that you were going to be joining the Early Learning Council. I've been a part of the Grand Articulation Summit meetings at the OAEYC conferences. It's been going on for decades, and there have been so many conversations and challenges around, for example, the transition, the differences between 2-year and 4-year universities, 4-year universities not necessarily having coursework related to actual classroom practice, but people are getting their step 10s and OROs and things like child and family studies and things like that, but that doesn't necessarily have the same kinds of coursework that people in 2-year universities are having around actual classroom practice and design and using materials with children and things of that nature. And I think my comment is more about zooming out. I think there's an opportunity with our Raise Up Oregon plan to kind of start thinking about what is it that we need to talk about in terms of 2-year universities, 4-year universities, and of course compensation that that we need to be addressing as a council. And so I just wanted to raise that. But I feel like what we're talking about here in this grant program, I understand it's part, there's enough to do right in front of us, but sometimes, we might need to zoom out and look at the bigger picture too.
Yeah, good point, Susan. It certainly is a bigger picture.
That makes.
Yes.
Ben, you had mentioned, the HEC will have some seats open in the coming year, and that just makes me think about, is there still this opportunity to have more representation from the sector on the HEC? So that zoom out and that constant conversation can happen.
Yeah, thanks, Callie. And the answer is yes, of course. We are a 15-member council, and every year at least 3 seats typically are up for appointment through just folks terming out or moving on. And so I think that will likely be the case again this year, with potential appointment windows as early as the next, I guess, later in the legislative session. The Senate will confirm, I think, what will be a second round of Governor Kotek's appointees to boards and commissions. And so we would welcome the addition of a member who has background in, interest in early childhood care and education, whether they're working in the setting, whether they have worked in the setting, whether they've been advocates in the space, or just have a particular passion for those issues. So I will make myself available. I know I've expressed this to you, Kelly, and I'm happy for other council members to hear it as well. If you know folks who may be interested in this and would like to learn more about the Higher Education Coordinating Commission and what service on the commission means and looks like, I'd be happy to meet with anyone individually at any time about that. Final thing I'll say is we are in particular need of a commission member who lives in the 2nd Congressional District, which is most of Eastern Oregon. We have relatively few statutory conditions on commission membership, but one of them is that we're required to have a member from each of Oregon's now 6 congressional districts, and with redistricting, our CD2 person got redistricted into CD5. So would love to find somebody from Eastern Oregon. And I know I've talked to a few folks, and I think there's continued opportunity for people to express interest and take those next steps.
Ben, thank you. And let me just tell you, since you're new to the council, that we will be happy to support whatever bill gets introduced, and as it starts winding its way through, to support funding of this program. So if you'll just be sure to let us know, we can write a letter, we can show up and testify, whatever the appropriate approach might be.
Terrific. And I think that's so important and so powerful. I have to assume that part of the reason why this proposal, that HEC's proposal for the investment in the early childhood grant program, kind of rose to the top of for the governor of the HEC's many requests for new funding was because it came with the support of multiple agencies. And I think it does look very different when proposals from agencies are developed in a collaborative fashion and are brought forward with support from multiple agencies or boards and commissions. It just feels different, I think. I have to think, for the governor, and hopefully it will for legislators to see that sort of shared commitment and support from the Department of Early Learning and Care, the HEC, our respective boards and commissions. So appreciate that, Sue, and really think that'll mean a lot.
Okay, good. We'll look forward to it. Thank you, Ben. Thanks for being with us this morning as well. We appreciate it, and good luck.
Yeah, glad to be here. Thanks.
So Ashley, I want to welcome you. We appreciate you being here, representing the Oregon Health Authority, and James sent his apology for not being here, and we know why he's not. So we appreciate you making time to join us.
Absolutely. Happy to be here today. I'm Ashley Tharstrup. I use she, her pronouns. I'm the interim government relations director at OHA, and I'm newer to this role, but I've been with the agency for 6 years, most recently as the director of health and education. So just underscoring what Ben just said about agency alignment and how important that is. Remy, do you have my slides I could pull up? Or would you like me to do that? Thank you.
Let me.
Sure, as you're doing that, I'll just get started. And I know we don't have a ton of time today, but I do want to walk through some of our key priority areas, our legislative priorities, as well as some of our budget requests that were recently in the governor's recommended budget. So let's see, yes. So I'm going to share information with you about policy option packages, as well as some of our key agency introduced bills that really impact the health and well-being of young children and their families. And then if you would like more information, since I will be going through this fairly quickly, you're always welcome to reach out to me after the presentation, and I'll connect you with more information. And then we're also going to be going more in depth at our Ways and Means presentations that are kicking off really soon on March 7th. So just a little teaser for that if you want to watch OLIS in your free time. So here you have listed the OHA 2023 legislative themes: eliminating health inequity by 2030 by building out health equity infrastructure. This is a really key area and continues on our path towards our North Star goal of eliminating health inequity by 2030. You'll see that equity is really run through all of our concepts and policy option packages. But this is a key piece to ensuring that OHA has the resources to really support our community partners, our providers, community members in further implementing our health equity strategies. We have a key area around stabilizing the behavioral health system as well, with the focus on the lifespan, really supporting people that are in crisis and communities as well, our partners who are in this full continuum of care. So we know there's more resources needed to build on the investments that were made in 2019. I won't get too into the Oregon State Hospital operations today, but that is a key area for us as well, and plays into the earlier goal around stabilizing the behavioral health system at large. There's a lot of work that OHA is doing in partnership with the Oregon Department of Human Services around protecting health coverage, and I'll get more into that in a few minutes here. We are working on building a post-pandemic public health system, really taking what we've learned through the COVID pandemic and helping to support our local partners and tribes in future, anything future that is coming around disasters, pandemics, prevention of chronic disease, suicide, alcohol, other drug misuse, and also addressing reproductive health. So there's a lot of work there around modernizing our public health system. And then last, bridging with the Oregon Housing Community Services and other partners to reduce houselessness by leveraging federal funds. And I'll explain that in a few minutes here. You can go to the next slide. Great, so I'll briefly walk through some of the OHA concepts and bills. And just so you know, the POP is the policy option package. That means there's funding requested, and that these policy option packages in front of you were all included in the governor's recommended budget. And just to clarify, OHA has no position, and we're not, this is also not a comprehensive list, but I selected some areas that I thought would be of more interest. So these are all around building and improving health equity, capacity, accountability, protections, consumer protections. And the policy option 401 is, again, getting into what I was saying earlier, just ensuring that we have the resources to really support and implement equity work in OHA and throughout our entire agency. So one area is creating a strategic action team to ensure equity principles are upheld in every new initiative and to provide additional staff in the diversity, inclusion, training, civil rights areas. And there's $5 million approved in the governor's approved budget for this. And the next is the Real D and SOGI implementation. So if that's a new term to you, that means race, ethnicity, what is the A? Now I'm blanking. Language, disability. SOGI is sexual orientation and gender identity implementation. And so this is around collecting demographic data and ensuring that our health systems can do that we have the capacity to collect this data and that we're able to really use it to drive towards our policy changes in our state. And then the last policy option package here is around the Regional Health Equity Coalition program expansion to add 5 additional Regional Health Equity Coalition areas across the state to really focus on building up those and supporting community level strengths and capacity to identify solutions through policy focused on social determinants of health. There were 2.1 million included in the governor's approved budget. And there's also a bill that I'll just mention, Senate Bill 564, which is also around Regional Health Equity Coalition expansion and funding that was brought forward by the Regional Health Equity Coalitions. Next slide, please. Great. So building on this theme area, we have a Senate Bill 216, which is currently in the Senate Healthcare Committee. This was an OHA introduced bill, and it's around ensuring that individual identifiable data, this Real D and SOGI data, cannot be gathered through a public records request, that it's protected. So it's around protecting people's health information. And then the next House Bill 2286 is ensuring that we are following through on a commitment made to the 9 federally recognized tribes of Oregon to ensure a federal match for Medicaid. And that's currently moved through the House and it's in Senate Healthcare. Next slide, please. So post-pandemic public health system, want to mention public health modernization, again, in just a little more detail. This is about continuing implementation of key public health priorities for local public health authorities to support their infrastructure and growth, tribal governments, reproductive health providers, and community-based organizations. And really maximizing those upstream investments to address disparities and address issues in rural communities. There was $50 million included in the governor's recommended budget, and there's some coalition activity happening around this. The House Bill 2278 is the pharmacist flu vaccination for all that you may have heard about. This allows trained pharmacists to give flu vaccines to patients over 6 months of age. So it moves that age range down and allows for more access to vaccines, to flu vaccines in settings where working families can access them rather than having to make appointment with their primary care provider. And that bill is also moving. It passed out of the House Behavioral Health and Healthcare Committee, and it's in Senate Healthcare now. Next, I want to spend a little bit of time on the universally offered home visiting statewide expansion. So this was included again in the GRB. There's 5.9 million identified to fund the full statewide expansion of the universally offered home visiting program for families with newborns. So all parents have access to critical services, skills, and additional resources supporting healthy families. So building on the work that's been completed so far through implementation of this program and continuing to expand to additional regions in our state. So that's exciting to see it in the GRB. Next, please. All right, so want to just spend a little bit of time talking about our the major work ahead of us in OHA, and this really does impact young people, babies and families. So the POP 201 is around our Medicaid waiver. In the GRB, we saw 128 million investment. This is going to be matched by close to 850 million in federal funds. The funds that OHA requested are for implementation of this recently negotiated groundbreaking 1115 Medicaid waiver that you may have heard about, to really fulfill its potential to interrupt many of the root cause problems that undermine health and quality of life in communities statewide, and to use federal funds as a demonstration to the federal government that Oregon can really build towards stronger health outcomes. So one of the key areas that was negotiated through the waiver is continuous coverage for kids until their 6th birthday. This is really important to interrupt the churn that happens when families' income fluctuates. And along with that, people ages 6+, up to age 18 are automatically covered for 2 years once they are determined to income qualify. So that also disrupts that churn. We negotiated for early periodic screening, diagnostic, and treatment services, or EPSDT, which allows all children to be screened and treated up to the 21st birthday, and to really receive that appropriate preventative dental, mental health, developmental, and specialty services. This entitles them to these services and helps to meet our health equity goals. We also, for the first time, and one of the first states to do this, we're moving from health-related services dollars to providing services through social supports, housing, nutrition, climate-related needs as covered benefits. So really allowing to use these federal funding for some of the, again, that root cause of poor health. So the work that CCOs can be doing to help support housing, to support nutrition, and to support climate-related needs. We're starting with housing and rolling that out first, and then we'll move into climate, and then eventually into nutrition. And that's really important, especially to focus on people that are in transition. So maybe in and out of homelessness, or moving out of carceral settings, et cetera. So we're really excited about that work. And then last, I'll just mention the redeterminations and basic health program. It's important for all of you to know that we, OHA and the Oregon Department of Human Services, will be embarking together on reaching out to the 1.4 million people that are now enrolled in Oregon Health Plan as the federal pandemic emergency ends in April. So here very soon, to ensure that people with fluctuating income who are right there at that income line, working families who move off OHP, have affordable coverage options. And as the public health emergency is ending, we're focused on ensuring, and preventing people from becoming uninsured during this process. So one way that we're hoping to do this, or planning on doing this, is through a temporary Medicaid expansion program, or a bridge program. And this is under our 1115 Medicaid waiver. And this will prevent coverage loss among people who might be less likely to enroll in other forms of coverage if they lose Medicaid. So it's a bit complicated to get into in a couple of minutes here, but again, happy to answer questions about any of this work, and just know that this is a major priority for OHA moving forward. Okay, just have a few more slides. Okay, so this is a new bill that I think we're still waiting on a bill number. We might have just gotten it today, but I didn't get the slide updated. Just was introduced in Senate Healthcare this week, but this is around leveraging Oregon's Medicaid program to increase health equity. The bill would empower people most affected by Oregon's Medicaid program to choose which quality metrics are used to increase health equity and incentivize better health outcomes through CCOs and through the Quality Incentive Program. So this would be a big shift. And we know that the CCO Quality Improvement Program has been a really powerful driver in the care delivered to CCO members. However, the selection of the CCO incentive metrics have largely been controlled by those who are employed within the healthcare system. rather than the people that are really impacted by these metrics. So this bill is really about establishing to this new committee, the Health Equity Quality Metrics Committee, to make decisions about quality incentive metrics. So at least 8 members would be OHP members and community representatives, health equity researchers, and then 4 members would be CCOs, providers, and healthcare reps. So wanted to highlight that for you. And I think my last slide here is around the behavioral health system. So policy option package 426, this is the child and family behavioral health continuum of care. There was 11.2 million identified in the GRB. And this is really around eliminating health inequities, addressing gaps and quality in the children's behavioral health service continuum. And wanted to mention this is a full spectrum of supports from prevention to intensive acute care. And it really responds to the needs of children, youth, and young adults from ages 0 to 25. Last is the Oregon Behavioral Health Crisis System 988 expansion, POP 404. So this would direct OHA to implement, expand, and enhance Oregon's 988 and behavioral health crisis system and declare a state of emergency for Oregon's struggling behavioral health crisis system. Would expand our mobile crisis team outreach and ensure that we're developing a seamless continuum of care through follow-up service, referral, and tracking. All right. And then I just gave you some key dates. I know many of you are tuned into the legislative process, but wanted you to see those just in case that's handy for you and how to follow along on OLIS. And then you also have a slide with our full government relations team. If you have a specific question, you can see the portfolios here. And with that, I'll see if there's any questions.
Wow, questions. Kelly.
I have a few questions. One is, and I noticed this when I looked through the packet, POP 442 is not included. That was to have a child health team. Why was that not included? Since that's really important to the, the early childhood work that we're doing. And I think it funded a few positions that would be focused explicitly on children within OHA.
Yeah, Coley, thank you for the question. I think it was not included in the GRB. And so I only included policy option packages that were included in the governor's recommended budget. So that one was not. I know there are, some positions that were included in that POP that we're hoping we can still provide coverage for, maybe through some of the EPSTT work, the early periodic screening, diagnostics and treatment work. But yeah, that's really what I can say there. I think that's more of a question for the governor's office, and I appreciate you raising it. Yeah.
Okay, definitely just a little concerning because of obviously the social emotional health metric, the child complexity data, all of that to be implemented requires looking at that and prioritizing young children, and people with expertise on young children are really important to fulfill that, which kind of leads to the second question I had around LC 475 that you shared. The quality incentive metric committee, will there be people that are part of that committee that are familiar with the social emotional metric and the health complexity, the child's health complexity data that can contribute to it via that vehicle?
Yeah, I think that's a really great point to call out. And as this bill just dropped, there's room and opportunity, I think, to ensure that piece is there.
Okay, last question. I'm trying to be quick. Sorry. That 426, you mentioned the expansion of pediatricians and child psychiatrists. You didn't mention infant mental health. Can that be included in that last one? Because we definitely need more, we need the expansions of professionals that are specific to infant mental health.
Infant mental health. Yep. I'm going to make a note and we can get back to you on that too, to see exactly what's covered there.
Okay.
Thank you.
Kelly, Peter.
Well, thank you. Actually, with POP 202, I know you didn't want to do, I know it's complex, but does this cover people up like to 200% of the federal poverty level or higher, or is 200?
Yeah, it would be going up to 200 for the basic health plan, which I don't think I covered as much as I could have. So apologies for that. So that's where we would be moving towards after the redetermination process. And as we're, working through some final negotiations with CMS.
And then for above 200%, is there a process to help people get onto the health exchange?
Yes, that's a key area. If folks are over income and no longer qualify for Medicaid or for the temporary Medicaid expansion program, then there is a step for ensuring that they have everything they need to get on the federal marketplace.
Great.
Yeah.
Thank you.
Thank you. Important questions.
Great question, Peter. Other questions from council members? Not Ashley, thank you very much. That was a very comprehensive view of at least these portions of OHA. You have a lot of work. Understand.
Thank you.
But you're obviously a very critical part of building an early childhood system for the state. So we really appreciate your partnership. And as I said to Ben earlier, as bills come up for hearing, if you or place where you'd like the council to support some of your work, I hope you'll be in touch with us. Thank you, Ashley. Alyssa.
Yes, hello.
Hi, we appreciate you being here for this long.
Yeah. Can't guarantee I'll be for the whole meeting, but no, thank you. It actually is a tough act to follow. I know you all had kind of our overview in your materials. So just wanted to highlight that I think we were really excited to see that early learning and childcare is, first of all, part of Governor Kochek's top 3 priorities. I think this is, we've seen significant investment. We've always been a priority of the last 2 governors, but to be in that top 3, I think does sort of elevate this work into a new realm. And I think the GRB really underscores that. I think generally speaking, what I kind of want to name with these investments is there's a lot of investments coming into Delphi. We're really excited to see so many of our policy option packages funded. And there's a 22 positions that are recommended for funding, which really gets at making sure we have a strong agency to do this work. But you'll also see investments going to other agencies to recognize really the work of this council and the cross-sector coordination that needs to happen to really impact young children and families. So there's also $100 million for facilities that would in the governor's budget go to Business Oregon. There's resourcing for technical assistance to access bonding, another $5 million for the co-location in housing and community services. And there's some early literacy and summer investments that could impact our preschool age children. So I think we're really starting to have an opportunity to talk about the role Delph plays, and we're not the be all end all, right? So really thinking about how do we have a seat at the table and coordinate and offer that expertise and leverage the technical skills of Business Oregon or OHCS or some of our other partners who know how to work with certain types of funding or getting access to services. And I think this really dovetails so well with what the council's been doing, the work of Raise Up Oregon, and really underscoring that no one agency can solve this alone. It really takes a comprehensive approach to reach the outcomes that we're all hoping for. I think we were really excited to see an understanding and support for enhancing our existing programming. So generally speaking, the governor's budget does not expand early learning programs explicitly, with the exception of Healthy Families Oregon, which we can hopefully reinstate the Lincoln County program that had closed. But it's really recognizing that we need to be able to support the workforce and offset the increased operating costs that programs are facing. Angie, I know you talked about hiring challenges in your program. I think Sonia had mentioned not having an HR director for a couple of years. I mean, our programs are not operating at full capacity. And so when we talk about access to services, we have funded slots, and we know that children aren't sitting in all of them because we can't fully function. So really excited to see that recognition that we cannot continue to expand until we right size our current state, and our programs and funding models really reflect what it takes to offer high quality programming in a variety of settings, promoting that mixed delivery model and blending funding stream. I think the other place we were excited to see some investment is on ERDC. This is a really new and significant investment. Last session in 22 was really the first big investment that we've seen the legislature make in the employment-related daycare program, with 26 million for us to increase ERDC rates specifically. This bucket of funds is a little bit broader, recognizing that we have to enter into bargaining and renegotiate rates, but that we really want to be able to serve more families with the expanded eligibility that was part of House Bill 3073. There's some IT changes. We also want to be able to help families navigate the system. So some resourcing for some childcare navigators, as well as some public awareness resourcing. Senator Frederick had mentioned that we too often as government don't think about the communications component. So to Kali's question about, with professional learning dollars, how are we accessing them? How are we making sure you have the right people on committees? This does include resourcing for us to recruit both childcare providers to make sure they're aware of the changes we've made to the program, and to families who are now eligible. So that's a very exciting development. We also saw resourcing for us to establish an internal quality assurance team. We'd heard from the legislature last session about concerns that we really can't guarantee that programs are offering high quality services. And as we really dug into this work, we said, you're right. And so the governor's budget recognizes that and gives us some resourcing to stand up a team that can go out into the field, see these programs, and offer that technical assistance and coaching, building off of the professional learning system investments in the early learning account. So I think it really reflects kind of the comprehensive approach to making sure that our program is supported. And this really dovetails into kind of the next phase. Ben mentioned that HEC will be going up in front of the Joint Ways and Means Education Subcommittee in April. We will be there next week. we are a little bit ahead of that. So I will be leaving early today to finish our PowerPoint presentation. David's going to probably step out with me. But this is an opportunity to talk about the 3 strategic priorities that we have kind of articulated this budget really supports. And that's recognizing that we need to continue to promote access to services. And again, that's making sure that our programs can function at the levels necessary to do that. We need to support our workforce so that we can recruit and retain the qualified educators that we need to actually reach the service levels we're funded to provide. And we need to be able to invest in sustainable operations as we become the Department of Early Learning and Care. There's bodies of work within that we're going to spend 3 days talking about next week, including some of the work on the licensing side. How are we shifting from punitive approaches to more of a support and enforcement companion process, technical assistance and coaching, looking at some of the systems we're trying to replace on the IT front, improving provider payments. So this is really kind of all encompassing in terms of how the governor has put forward her recommended budget, and really the trajectory that we're on as DELC. So we are going to be up in front of the committee on the 27th and 28th of February, as well as March 1st. And March 2nd is currently slated to be the day for public testimony around our budget, before they head into the next phase of the education continuum with the Department of Education. So wanted to make sure that is on your radar as you think about the role of the council and kind of the opportunities there. But we'll be walking through the budget in more depth and kind of talking about how the pieces all fit. I think the last piece I would maybe mention is we were very fortunate that in this economic context, we did not see significant reductions proposed to our budget. And I think this again really is a testament to Governor Kotek prioritizing and recognizing the importance of early learning and childcare. So we only saw 1 vacant position recommended for reduction, some vacancy savings in services and supplies. So travel, pens, printing. There was a slight reduction to employment-related daycare alongside the increased investment, recognizing that historically this program has been underspent. And we're really just in a transitional place where We just implemented some new eligibility policies in January. We're not going to know what that does to the cost of the case and the caseload. And so there's a lot of unknown variables that are going to affect the way the employment-related daycare program operates and what it costs to operate. And we're committed to keeping the governor's office and the legislature and you all apprised of what we're learning as more of these policies start to take effect. David, anything?
That's so bad. Wow, questions,
Yeah,
Anne?
Alyssa, can you help me understand why ERDC has been understaffed? Is it just the capacity issues that you're talking about?
I think it's a few things. Administratively, there were some policies that we knew made it difficult for the program to work. So we used to have one of the highest copays in the country for employment-related daycare. Our average copay now as a result of House Bill 3073 and the investments we've leveraged in one-time federal funds, it's $14.51 is the average copay. And it's not going to go above $130 for a larger family. So that's been a huge shift. We used to see families drop off at about 160% of the federal poverty level. So take-up rate was low and the churn was high. Families were not staying in the program for very long. We also had a policy where providers had to pay and to submit their billing after the month ended and say, out of how many days, here's how many days the child showed up. We've shifted to enrollment versus attendance. So it's those kind of programmatic that was difficult for both the provider and the family that we've started to address. Yeah.
And I would also just add that the sort of the way the budget box works for ERDC also makes it a sort of more complicated, right? Because it's for most of for other programs, right? We know basically what the cost per child is, and then the legislature allocates a certain amount of money that funds a certain number of slots, right? And the thing with employment-related daycare, the cost per child really changes a lot per month. Are there more infants showing up? Are there more school-age care? Or are people needing more half-time hours? Are they needing full-time hours? And so I think part of the way the program works is that you monitor the caseload and the cost per case. And if it looks like you're going to get over budget, then you would need to do a wait list. And I think because of all of those pieces, it's also not been a program when there's been a lot of public information or reach out to parents, or because I think nervousness about how close are you getting to the over budget and to the wait list. So I think ironically, some of that also contributes to the underspend, if that makes sense.
But they're streamlining some of these pieces, right? So it's easier to use.
Yes, yeah. So we've now done enrollment with attendance. The rates are much higher, which is why the copays are the rates are higher and the copays are lower. So if a family isn't paying their copay, providers may be out $14 instead of $300. We also are going to have protected 12-month eligibility, which gives more stability, not just to the family, but to the provider as well. That's kind of becomes more of a guaranteed source of income. And then David kind of alluded to this, but in January, we shifted the way hours are calculated. So we're having flat, part-time and full-time. So instead of the child having 13 hours of care a week, they're going to get 20, and that's going to work a lot better for both the family and the providers.
And I think everyone involved in the program also recognizes there's additional streamlining that we would all love to do some of that streamlining will also depend on the movement to the new provider management system. That's a little bit, that's down the road. So I think there's more work to do.
I have a question. Are there any differentiators that allow for more reimbursement, like a child that's in an early intervention, special ed, or a child that's in the child welfare system?
Yeah, generally speaking, David can fill in, but yeah, so the rate varies based on the age of the child, and we do have a high needs rate available. And David, do you want to kind of talk about the tables a little bit?
Well, and I think just so I think part of one of the pieces that HB 3073 that we haven't implemented yet, and is also tied to developing the new provider management system, is that sort of longer list of things that we would like to be able to incentive. So we do actually currently have additional funding for children with special needs through Inclusive Partners, but some of the other incentives, like for non-standard hour, evening and weekend care, So I think those are part of that longer work towards being able to move towards alternative rate methodology, right? So currently we do have differentiation, for ages, so there is,
Yeah.
infant care is more, but I think some of that work to incentivizing particular forms of care. I think that's really also tied into that movement to alternative rate methodology. But to do that, you also need to collect different kinds of data, right? So to be able to sort of say, currently we don't have the ability to collect. Are you providing care in non-traditional hours, right? So that's part of why that movement to alternative rate methodology is also tied to be able to implement the new provider management platform. So that'll help with some of those conversations on what we want to incentivize and how.
It will not surprise you that I will ask the question about the rural urban disparity and equity on that. Have you taken that up? Are you planning to?
So was it 17 data or 19? We collapsed. There were 3 rate tables
Right.
and the third rate table was collapsed into the second.
Yeah.
So we're looking, I think with the alternative rate methodology, we're looking at that, but there are some distinct differences in terms of operating costs for our more urban programs versus our more rural programs. And alternative rate methodology will help us get, I think, a finer look at that. But we do know that it does cost different amounts to run those programs depending on the location.
And then just always want to just remind folks that the reimbursement rates for employment related aid care in the end are actually set through the collective
Yeah.
bargaining agreements.
Yeah.
And so that bargaining will probably go into early summers, sort of the normal pattern. So that's so we can help establish a framework around rates, but the actual setting of rates is really part of that collective bargaining agreement.
And how long into the future will that be?
Starts this in March.
We'll start the next round of bargaining in
Yeah,
March.
and it'll go until, they usually wait until session ends to see where the final budget landed.
Yeah.
So probably July is
Yeah.
when it would kind of be finalized.
Yeah, and so I just think the fact that you've increased the rate generally has helped a lot in rural areas. There's still the differential. I think the latest we saw was there's a 30% differential and the difference in providing the costs.
Right.
Providing it is 8%.
Right, right.
So there's still
A gap.
a gap and
Yeah.
statewide, one fee, one level would be just so great. Okay, thank you.
I think my comment is about the kind of the shift in licensing from kind of moving into a more supportive role. I'm hearing on the ground anecdotally from people that I'm talking to that, as licensing specialists are kind of entering into that relational place, there's a need for, I don't know if it's professional learning or some programming that actually supports some of these directors beyond the actual licensing specialists. And so I'm wondering if that's showing up in the funding somewhere. I also see that as related to the equity fund, because I know the equity fund going to culturally specific organizations, but part of it was also capacity building and helping programs to kind of develop. And so I can see that being an important mechanism. It's different than I think the kinds of professional development I'm seeing currently out there.
Yeah, Subin, it's not outlined as a new investment, but I think as we're continuing to define the professional learning system, there's opportunities to refine that. And as we also develop what this new approach to licensure looks like, when we think about coaching and TA and what programming and supports are needed to help directors be successful, we'll start to get that information through that process and see where the gaps are and what needs to be offered to really make those moves. Yeah.
There's one more question. I was looking for baby promise in here. Did I miss it?
Baby promise was not recommended for general fund investment in the governor's budget. So it will continue as a
As is.
federally funded program as is in 3 regions.
I see.
Yeah, I
Okay.
think that's why she said no expansion, you asked for expansion.
Yeah, we wanted to go into new regions with
Yeah.
that program, and the governor really wants us to kind of right size what we have and make sure that's on solid footing before we look at this.
Okay. And what are the 3 regions?
I can get you the map.
And
We
the-
have the South Coast, we have Multnomah, and we have Central Oregon, but I can get you the counties.
Oh, that'd be great.
Yeah,
actually.
yeah.
That would be great. Yeah. Okay, thank you.
I wonder
Good
if
question, Ann. Yeah.
just more of a comment, if there can on the EDRC.
Mhm.
If there can be some communication on the website about as the transition, one thing when we were traveling, this came up a lot and we had no idea And they clearly could not find anything on the website, so I feel like the more communication in this transition period, the better, just so folks can understand.
Yeah, absolutely. We have a full project assigned to this on the website generally and how we're making information. It obviously lives on the ODHS site now. What we're porting over, what information is most useful and what needs to be developed or refined, as well as just overhauling our navigation and website so that it's just easier to find information more.
Well,
generally.
there were questions about timeline too, like, do we go here, or do we go here? When does it
Yeah.
move? And so,
Yeah,
just.
yeah. And we're going to make sure that there's no wrong door. So redirect
Okay.
links, right? So if
That's
someone's
great.
got something bookmarked, they're not going to get an undeliverable lander, right? So we're going to make sure that we have as many connections so that nobody feels like they're kind of getting redirected. And as we get a little bit closer to July, we will start pushing out information about what you can expect. What does it mean that we're going to be dealt? What lives here? And then hopefully if we see this investment in kind of public awareness resourcing, that'll be a part of kind of making providers and families aware of BRDC in particular.
And then I know, Lois, I think already mentioned this, and it's a little bit more long term, but one of the decisions in GRP is around communications focused on ERDC, and I think it's really meant as a sort of customer service, right? Of making sure that we have good, clear, frequent communications with families, with providers. So again, I think that was a really customer service focused
Thank you for
communication
mentioning
division.
that, David. ERDC has never had a dedicated comms. And so it was little pieces of lots of people at ODHS. And so we didn't receive funding cobbled together from ODHS, but the governor's budget recommends a dedicated investment there.
So how long do you think it will take for Delk to get up to capacity to do all of this?
$500 million question.
We're working now actually on really defining minimum viable.
Yeah.
And the work from there. So what has to happen so that emails work, lights are on, dollars are out the door. And that when people call the OCC line because they have a complaint or a need, the phone will ring. And then.
Then you figure out who answered it.
Exactly. Let's keep the wondering. It can be challenging on Sunday. And then what can we expect by the end of the calendar year? What's going to take to the end of the biennium? So our hope is over the next 6 weeks or so that we really can articulate that clearly so that you all legislators and our internal teams and partners kind of know what to expect when.
Yeah.
For the grants management system, for example, our goal is to make sure people can claim for their funds.
Yeah.
Phase 2 will be heat maps that show where the dollars are distributed and all the cool bells and whistles, but like, what do we need to be able to do the work on July 1st?
Good for you. Really think we have, like, what are the really top priorities just to be functioning?
Yes.
Yeah.
And we will make sure that we set expectations in advance so that you all know what we think, what we're working towards doing and what might take a little bit longer. We've been really trying to tell folks, it's not a whole new day on July 1st, but we want to be able to really articulate what that.
Minimally viable, it's terrifying. Actually,
Gotta, it's got the government.
yeah. I have a daughter who's an OBGYN, so it's got all sorts of other implications. So March 2nd should be on our calendars, council members, to attend and or speak and or get testimony, whatever. We can coordinate that as a council. I know you're not involved in that, Alyssa, but know that we'll be excited to sign up. Probably support that.
And I would just also, if we can give you updates, it wouldn't be the first time that Ways and Means find this out behind the schedules and they change the date. So just
March 6th would be kind of the backup date because the committee doesn't meet on Fridays. So if they're running behind March 6th, that ends up being the testimony day.
Okay, well, that holds all of our calendars. And so we're running behind council, surprise. So we're gonna have to come to, Alyssa, thank you for that. Obviously, we could talk with you a lot longer. We're gonna have to come back and see if we can fit into somewhere in our agenda, talking about the information in our packet from ODE, from ODHS also, and then the Early Childhood Coalition sent in their priorities, legislative priorities, which we may want to take a quick look at, even though they're not yours, Alyssa. So we will try to circle back, if we can find time to this. Okay,
I just want to say thank you for your leadership. It's really impressive.
Thank you. I feel so lucky to be able to continue working. It's been a long time. I'm really excited. for you.
we are too. Well, you gave birth to this
Yeah.
thing way before we were here too. Okay, Peter and Peg, and I think Christy, yep, I see you on the, there you are. Yes, got it. Welcome. Good morning, Christy. Thank you for joining us. We are running behind, but we are also going to give you more time, and we'll just either run into our lunch hour, Remy, or we'll try to tighten up the rules. You might warn staff if they don't already know it.
I'll definitely work.
Okay, thank you, thank you, thank you.
I will help by not talking, and I'll just turn it over to Peg.
Well, I'll kind of kick things off just to sort of ground us. Remember that this home visiting system work is really cross-sectional, and it really focuses on improving and the coordination and collaboration of all the prenatal programs, or all the programs really going from prenatal to age 5 in the state of Oregon, regardless of what their funding source is. As sort of a way of an announcement, remember there are 3 co-chairs of the working team who are also non-voting members of the home visiting committee. One of the co-chairs, Benjamin Hazelton, who was the longtime Oregon McVie lead person with OHA, has recently taken another position. And so his role on the working team will be covered by Pamela Ferguson, who's from the OHA, and she'll join Gwen Batchley and Ruby Ramirez. Gwen is from the ELD and Ruby from the OCF. Just as a reminder, you remember in December, we brought the home visiting system recommendations that were developed by the working team and reviewed by the home visiting committee to the council. And then in January, we developed kind of key elements for effective planning process. And now Christy will give us kind of an update on what the next steps are. Christy's our consultant for both the home visiting committee and the working team, and her expertise and insight have been really valuable. So thank you, Christy. I think it's all yours.
Thanks.
Great, thank you so much. Thank you very much, Sue, and thanks to the entire council. Remy, I think we had a slide deck that goes along here with this.
Then me share the screen really fast.
No problem. But yeah, thanks everyone. It's fun to see the group there in person. I wish I was able to be there with you all, but it's nice to even imagine you all together and see you there. I'm glad to be providing this short update, but also really excited for the 12:30 to 1:30 panel that you have, this expert panel with parenting, education, and home visiting collaboration. Folks, I hope that you will see a lot of connections between what I'm going to share this morning and what the panelists will share with you this afternoon. So looking forward to tuning into that. The next slide, please, for me. All right. So it's time to get your visualization on. So you got to take a look at that beautiful community garden. This is an analogy that has been helping me think about and also imagine the home visiting system work over the past several months. So if you will, indulge me and just picture either this community garden or a community garden that you know well that is near you. And let yourself think for a minute just about what it takes to make it thriving, to make it successful, to make it productive, and really above all, to make sure that it's well used. Just picture that, like, what does it take? For me, the analogy really highlights the multi-level nature of the work of a community garden, but of course, I'm going to be using home visiting as that analogy as well. You have, of course, soil and seeds that are required. You have end users who are enjoying, the fruits of the labor of the gardeners who've been tending and raising each one of those beds. You also have this more invisible infrastructure or support that makes sure that a community garden thrives and is productive. You have water and getting it to the site. You have tools that need to be maintained and replaced. You have electricity. Of course, you have the land and the real estate itself. So this infrastructure of supports that helps to make the garden itself successful. And also, I think also a great analogy too, as well, just from at a glance, you can see that the raised beds kind of look similar. And they're similar. They're growing plants and usually edibles. And they also have really a unique feature, right? And each of those unique features attract and serve different clients, in this case, children and families. I also think that the analogy works when you think about a community garden being stronger and more community or family centered when it's coordinated, where those people and organizations that are in charge of each of those raised beds, they can help families get through the gate in the first place. They can make sure that people know about the community garden. They can talk about and make sure that the navigation between the different beds and the different programs really meets families where they need and what their needs are, and gives that family the choice that they deserve. And of course, both home visiting systems and community gardens take a lot of planning. It takes time, ongoing maintenance, and care, not just once, but season after season. So I hope this is an image or a picture, analogy that can help you think about this work in this broader sense, and especially in this beautiful sense of growing things and tending and caring for it over time. And we'll come back to this analogy at the end of the presentation. Next slide. Thank you. Well, hopefully this slide is starting to look familiar. It's been presented the last couple of times that the Early Learning Council has been together. Also, I'll just note that the full list of recommendations are a part of your materials package. This next short section that I'm going to speak to, I'm going to really focus on those three highlighted early opportunities: the investing in relationships, the aligning home visiting system funds, and then family leadership. And I will also be helping keep our North Star, and that is the Home Visiting System Committee's North Star, in front of us, that this whole body of work really has an emphasis on regional decision making and implementation with support from the state in that support role. Next slide, please. Before talking about a few of those early opportunities in more detail, I just wanted to share this really simple visualization for how we might think about the planning timeline for action. I would just really think about the excitement that these early opportunities are early in action. We're not waiting to get to action. We're not waiting for some other time to do the work that's needed to get some of these early opportunities rolling. They've already started. And I'll talk more about that in a moment. But I think just imagine and make sure hopefully this visualization helps to show the embeddedness of these early opportunities as part of what would be a longer body of work. I think that the strengths of a shorter term work or thinking about earlier opportunities, it helps build trust and momentum, and also some of the building blocks of those early opportunities are what will be needed for the more complex planning. If you think about the longer term, more comprehensive piece, we had a lot of great advice to try to line that up with the next long session, legislative session. And the reason for that, one may be obvious, is that if there is a legislative ask or need for support, it'll be in step with that lead time that's needed. But the other is that it gives more time, some more breathing to be more inclusive in these processes, not be in such a hurry as we were to get to recommendations last year. Because being in a hurry often leaves out voices, people and communities, and we don't want that to happen. But I think it also, this longer term vision allows, but not just allows, but anticipates that we'll have new info. There may be new home visiting programs coming online. There may be new home visiting system partners that aren't yet identified that are going to emerge and that are going to be folding into this dynamic process. So these early opportunities, as well as long-term planning, they're really predicated on what is already very much in place, but we'll need to continue, which is motivated cross-sector leadership, like those on this council, but also on the committee level and the working team across regions, and also resources to support the processes, which I'll talk more about in a couple of slides. So in these next 3 slides, you'll see that I've really emphasized the state and regional pieces of this. I think we have to really make sure that that North Star is nothing short of the North Star. And that as I showcase a few of these, some of the information on this slide, think of it as the kinds of steps that will need to be taken over the next 6 to 12 months. So that early opportunities arrow that you saw just a moment ago. And just to keep this, to make sure that this is on top of mind, I'm just going to read the recommendation language around investing in relationships. The recommendation says that we as a state should dedicate resources and employ change management principles to support regular convenings of home visitors, home visiting leaders, and cross-sector partners to learn about one another's programs, share professional development and training, and begin to work to create stronger collaborations. And so if you'll see on that left side, when you think about the state and building relationships, it's about getting people together. And I think that there's several different groups that need the opportunity and time to get together. The Oregon Home Visiting Model Collaborative is an existing informal group largely made up of home visiting program model leads. And that group certainly has so much to offer, and a re-engagement or a better engagement of that group is much needed. I think that the Home Visiting System Committee, and Peter and Peg, you can agree or disagree, but they really haven't had time or space to focus on their own relationships between members, to understand what each other does, what each other's programming responsibilities are, as well as personal connections. I think for the state, the updating, engaging of early learning hubs, of Oregon Parenting Education hubs, of course, of the advocacy coalition that is so strong in Oregon, and so many others. There's some communication that needs to be done. And I think that is a strong part of relationship building, is making sure folks know about, or at minimum aware of, the work that the Home Visiting System Committee and working team have undertook and where it is headed. And then I just highlight a few things on the regional side of things in terms of relationship building, which again, in a nutshell, is about people having a chance to hang out together, but with intention. And so consider some of the things that have worked in Southern Oregon and in other parts of the state is making sure that there's a opportunity for home visiting learning circles where home visitors and home visiting leaders can get together and share about each other and the programs. I think we all imagine that home visiting programs know a lot or know everything about each other, and that is rarely the case. I think lots of times there are misunderstandings or misconceptions that just by learning more about each other's program models can help to dissipate. There's always opportunities for shared professional development between not just home visitors, but also parenting educators and other family support professionals. MCV, the Maternal, Infant, and Early Childhood Home Visiting federal funding stream, has helped with some of these state and regional professional development efforts in the past, and I believe is in a good position to do so in the future. And then the building of relationships, I think while you have folks together in either of those two settings of learning circles or PD, there is a great opportunity to launch or use some of the evaluation baseline data tools that the Ford Family Foundation has, which is one of theirs, is a very strong tool called their annual systems survey. That is an opportunity to gather baseline data so that you can try to make tangible what seems intangible, like things like communication and trust, and also, of course, where to focus attention over time. And I have to give one example because it makes my heart happy, but it also highlights the important use of data, even in this survey template. And so here's an example of an item that comes from that survey. So it asked respondents to rate the effectiveness of communication between home visiting program leadership. So supervisors, managers, directors within the region. In year one, they agreed at about a level of 26% that there was good, effective communication. After just 1 year of networking, spending time together, learning about each other's programs, and starting to ask questions about how to strengthen collaboration, the survey showed 71% of respondents thought that there was effective communication. And now 7 years later, it's at 92%. And so not only does this give you a chance to kind of feel that the progress is measurable, but it also shows where focus and attention is needed when you don't have such strong upward trends. Next slide. A second opportunity that I know you have heard loud and clear already, and that I think has probably some of the most traction in terms of work that's been undertaken, is around identifying aligning funding. I'll read the recommendation language so that you can hear what that sounds like and then see some examples, but it requests from the state that it adequately resource the implementation of the Home Visiting System Committee's recommendations, starting with FTE. So dedicated state level FTE that provides leadership, helps to staff governance structure and move recommendations along into action and supports some local work, but also regional levels require dedicated FTE to actualize home visiting system recommendations as well. So on the state level, there's a need for identifying multi-year commitments from public and private sectors. Those meetings are already underway, thanks to Sue, Peter, Peg, and others. And we think about that in terms of philanthropy, but also the public sector, since we have home visiting programs that live in the Oregon Department of Education and Early Intervention. Oregon Health Authority, as you heard, has very many, including the Universal Home Visiting offering. The Department of Early Learning also houses some DHS as well. And then of course we have federal home visiting programs. So we've got every sector you can kind of name. We've got those folks that can be identified for support in either financially and or through governance and oversight. And we're still in the exploration phase of thinking about where those home visiting state level FTE would be housed. In the regional level, when you think about identifying and aligning funding, one really important fund that's been around for 10 plus years is the SMCV funds. They have some regional, and the regionals in this case are county level, that it's already out there. And there's an opportunity maybe to update and align some of those funds with home visiting recommendations that we're seeing here. But there's also maybe less in terms of like dollar signs, but more in terms of resources, the experience and structures. You have parenting education hubs, which are systems level efforts, as are early learning hubs. They definitely have experience and structures that could help support some of this work. And finally, again, may not be a financial funding item, but I would call it good as gold. And that is the framework that the Ford Family Foundation and its partners have developed for the theory of action on how you do home visiting system coordination. There's so much to build from there and so much to learn from.
Christy,
Yeah,
how about if we intersperse questions as you go?
sure.
Okay.
I could finish up this last family leadership slide, and then that would be a great 3-slide chunk.
Okay.
Would that be all right?
Yep, perfect.
Great. So I'll just finish up here that not families and through the entire findings of the working team and committee, their recommendation is to build or strengthen local regional structures to make sure that there's ongoing family leadership, co-creation of policies, recommendations, and strategies. So at the state level, kind of taking some time to identify and find out who's doing work in this arena at the state level, what kind of resources or individuals support family leadership. And then something similar in the region was to making sure that we really have documented and know about the existing prenatal to 5 parent leadership groups, formal or informal, that we can help to engage and perhaps formalize. So I just, in closing for these 3 slides, just really want to identify that those relationships, aligned funding, and family leaderships are showcasing both the need for state and regional level work, thinking about it in terms of work over the next 6 to 12 months, and that there's already activity and action. We're not waiting to get something started, but really thinking about action starting as of even last month. So with that, Sue, I hope that's okay. We'd turn it over for you for any questions that people might have.
Kelly,
I'm wondering, I didn't see the mention of community health workers, and I'm wondering if you see them as part of the ecosystem of home visiting.
Absolutely. Was that Kelly? Sorry, I have a little trouble.
Yeah, Kelly.
Yeah, absolutely. And I think if I recall correctly, that the community health workers definitely are called out specifically in one of the recommendations around professional development. And so I absolutely do, as well as doulas.
Okay.
So that's the short answer to your question.
Okay, great. And then I have a wondering around, there's a lot of work that's focused, that's being developed around House Bill 2166 and like preventing suspensions and expulsions. And I feel like some of this integrates home visiting, though it's about going to the home. I'm wondering, like, are there pieces of this that can integrate with what we're setting up to support early childhood workers? Because all of it is about supporting children. And I don't know if that's something that seems out of the realm to you. So it's just a wondering if there is a linkage potentially there.
Yeah, I do see some. Peter, I see. Do you want to respond? Would you like me to start and pass it off?
It's a great question. Yeah, it is totally linked. Some of the home visiting programs like the doulas that we have in Jackson, Josephine, Klamath, and Douglas, they often don't actually go to the home. They actually will meet the family in a park or a community center, but they really do focus on that. And it also ties in with the CCO's metric on social emotional health for kids as well. So Kelly, it's a great question. I think this all fits together. And I think that the everything we do with the home visiting program has to be linked in to the idea of how are we going to make sure that children are coming into childcare settings and coming into preschool settings, learning social emotional skills, and how that ties into our overall efforts to make sure every kid can enter kindergarten ready to thrive.
yeah, thanks, Peter. Great question,
Yeah.
Kelly.
I would add, it's say maybe similar concept, different language. I think there are examples of infant and early childhood mental health consultation. So mental health consultants coming to support home visitors and parents if the home visitor themselves doesn't have the background and training needed. But there's also lots of opportunity. I know I mentioned this before when we saw each other, that the Oregon Association for Infant Early Childhood Mental Health has a really amazing opportunity for people, professionals of all levels, to learn about and receive reflective supervision about infant mental health. And I think that those are very much linked in with what I imagine the prevention of expulsion will also be focused on.
I think too, that the home visiting, and we've talked before about this, it's really all about relationships. And if we can start off early with developing a trusting relationship with a family, I think that the opportunity to then provide services specific to that family's needs, whether that's to help them with social emotional development or to help them access physical health or education or daycare or whatever, then we're a leg up, because then we've already established that trusting relationship with a person who knows what resources are available and can help the family then decide what resources would be most beneficial to them.
Yeah, thanks, Peg. It's really is that wraparound approach that, yeah, thank you, Peg. Great question, Kelly. Christy, we'll throw it back to you for your last slide. Or two.
Fantastic. So on the next slide, So the last month or so has really been focused on gathering insights from our working team members, co-chairs, committee members as well. Just thinking about what it takes for successful planning. So getting a little meta on that question, but wanting to start with all these things in mind. I know that you all had a chance to see this when Peg shared it last month, and you shared some additional insights. I'm not going to go over all of them, but I do want to touch on two of them. One of them is the realistic timeframes, and the other is trust. I just this is nothing that you all don't know, and so maybe it's just a reminder, heartfelt reminder about that systems work takes a long time. And so in the two investments that I had the opportunity to oversee at Ford Family Foundation, the two are the Oregon Parenting Education Collaborative, which is a systems building effort for something that didn't exist basically in any state, let alone Oregon. And that is the collaboration between parenting education programming. And the second system effort is the Home Visiting System Collaboration Project, which I'll just highlight that OPEC, the Parenting Education Collaborative, started in 2010, but had several years of pre-work under its belt before it launched. And that Ford Family Foundation's Home Visiting System Collaborative now, I think, Anne, you may be there in its 7th year, maybe its 8th year. And it had 2 years of pre-planning work before it launched as well. Now, I don't mean that any of this work of Oregon should take that long, because there's so much to build upon, not just from those two efforts, of course, but the early learning hubs, and also the work that McVie and Oregon Health Authority has done in its systems work around home visiting. But still, like, Oregon hasn't ever had, it's currently building an early childhood system. It's never had a statewide coordinated home visiting network. And so we have to be both optimistic and realistic about the long-term nature of this work, especially when you are thinking about so many diverse people, partners, agencies, regions, programs, and most importantly, families. So it's going to take time, and it certainly, as you know, will take intention. Which brings me to really my final remark about trust. Next slide, please. So I realized that I have a really like a personal simplified version that trust is built by listening and responding with great care with what you've heard, not what you wanted to hear, and also doing what you say that you will do. But this trust quote really frames it up in a different way as something collective, really not quite so individual responsibility as my simplified version. So this quote from the Lancet last year says that trust is a shared resource that enables networks of people to do collectively what individual actors cannot. And I think that really, in a nutshell, it brings us right back to what it takes for a community garden to be successful, and to the very nature of this home visiting system building work that they'll undertaking on behalf of children and families.
Okay.
Thank you very much for allowing me to share these remarks.
Thank you, Christy, very much for sharing this, but also for your work and leadership to get us to this point. So we are moving forward. Peter and Peg, would either of you, both of you, want to add some thoughts to what we've heard and talk a little bit about next steps? I know your committee is meeting next week. So where are you two leading us?
Well, I don't want anything. I think Chrissy covered it very, very well. And I think that we'll learn from the panel this afternoon. I'm looking forward to that. But I think she put on, Chrissy had on the slides, really the next focus is, how do we nudge forward the conversations about the budget, about the funding for the FTE, and then how do we nudge forward the conversations about where the program could be housed. So those, I think, really come to mind to me. Peg, Christy, I don't know if that, Christy's nodding, so.
Okay.
I would agree with that. I think it's been a while since we've met, and we need to start building some relationships within that committee to establish, again, I think trust. That's sort of the basis of this, right? It's the basis of home visiting, and it really enables all of us to work more effectively together. So I think all of those things are important. I do think that we want to keep momentum going. I think there's that, we have to be patient and let things develop, but we also want to be sure that we're not losing momentum.
Right, really good point, Peg. Anne, and then Tully.
So first of all, I just want to thank Christy, Peg, and Peter for taking the leadership on this and for moving this forward so much. And especially you in your role, Christy, I really appreciate it. I really liked the way that you had different levels of, the state and the regional, and focusing on family leadership, aligning funding and building relationships. And I want to ask, I want to get to a question about what's needed to make the state level collaboration work better. And what we need to do that, and where the pitfalls are, and how to give that teeth, and so on. Because I think from our perspective, from the Ford Family Foundation, thanks to Christy's leadership when she was working with us and started this work almost 10 years ago, with incredible vision and incredible trust building and everything at the regional level, we have learned through her leadership and that we did in Southern Oregon, that it really is possible to see that collaboration on the ground at the regional level. My question is about what it's going to take to make that happen at the state level, because we've seen it happen at the regional level where people are on the ground and delivering services. But at the state level, I mean, I want to ask this question in total naivete and in a non-judgmental way at all. But the question that I have is, how do we make that real? It seems to me that that's got to have teeth. How do we make it happen? What do we see as potential obstacles to that? What role can the ELC play to make sure that we're pushing to make it, that state level collaboration, that state level home visiting model collaborative, and the state home visiting committee really can require and make the cross-agency collaboration real?
Great question. Peter, hey.
I'll take a stab. It is a great question. It's a key question. And I think the way Chrissy set it out too, is we have to empower the hubs, I think, to be leaders in each one of their regions on this. The council has that great role that we can work with our colleagues in the different agencies that have a piece of the home visiting program to coordinate and to move things forward. We have a chance every month to meet with agency directors. So I think we can use our council meetings as a way to say to OHA, to DHS, to ODE, that and we need to keep moving forward. We need to get this organized. We need to get it set out, and we need to reach more families. So I think that's a simple answer to a complex question, but I really do think we have the pieces through their learning council and the statewide effort. We have the pieces with the relationship with the hubs to do work on the regional effort. We just have to make sure we use the pieces intelligently and aggressively.
Yeah, thanks, Peter. Great response, Christy.
So I have a couple thoughts about that, Anne. I think to try to be not just say, well, it's on the relationship slide, but I want to say that like it's on the relationship slide. That is one way that work happened, and you articulated that, but it's not just that all by itself. So I think the things that were extremely important with that regional success is that there was a really strong, lovely framework in the theory of action that gave some sideboards to the work, and it also gave some direction and some purpose, mission, and vision. So that is one very strong and most important factor, and it comes into play, I think, every year, and it has every year since, alongside with a very robust and very carrot not stick focus of an evaluation that is meant to support ongoing learning, ongoing and continuous quality improvement that shines a light on things that are going well and things that aren't going well, or things that aren't moving forward, so that technical assistance can be focused in those areas, or regions can focus more on those areas while still maintaining the ones that are going well because of that ongoing maintenance. So the framework, the evaluation system, and then the long-term commitment of Ford Family Foundation, so not making it a 2-year grant, not making it a 3-year grant. So again, into its, I think, 8th year, and if I understand, expanding. So that long-term commitment from the Ford Family Foundation that is always relationship focused. And then I don't know about giving it teeth. I guess I would say instead like formalizing relationships, and each of the regions had to really develop MOUs or memorandums of understanding or memorandums of agreement between high-level structures, so CCOs and the home visiting coordination work, the early learning hub from different programs. And so MOUs are really an important tool and will be at that state level, but also for the regions as well. At least for my maybe naive standpoint, I don't know how, you need to be able to articulate what it is each of you are going to do over time. By each of you, I mean each of the partners, agencies, and otherwise. So that would be my longer answer to your question, Anne.
Thanks, Christy. Peg?
I just think we have some experience with cross-sectional work with Raise Up Oregon. And maybe we can build on some of those relationships as well. And it's a little bit easier because we're not going to be involving the state in the actual programming part of this. It's really more the structure and funding. And so again, I would hope that we can build on some of those things.
Good point. Good point, Anne.
Yeah, that's great. Thank you. And I just want to follow up. So do you imagine that there would be, so the framework that exists that you said was so powerful was really at the regional level, Christy. Do you imagine that there will be a state level framework? Do you imagine there would be state level memorandums of understanding and state level sort of transparency about the budgets that each agency is bringing to this?
Yes, yes, yes.
Okay.
And I just want to second what Peg has said just a second ago, which that any of the things you just said, the MOUs, the shared funding, those pieces would be towards the system collaboration development, right? So we are not talking about program funding. We're talking about the collaboration between programs and the coordination between programs, the support of them as well.
Great, thank you. And I would just throw out in very preliminary conversations we've had with some of the agency partners, they're very clear. They're going to have deliverables that go with their funding stream. So you're right, Anne, sideboards, whatever you call it, there are going to be some real specifics in what is each agency funding and getting for their funding.
And who's going to do that? Are Peg and Peter and Christy going to do that?
Peg and Peter and their committee are going to be providing leadership on that. Yes.
Okay, thank you. Sorry to keep going down. I just want to make sure I have a clear sense of how we're going to do this particularly.
And the council will be a partner. Don't worry, Peg and Peter, we're with you all the way. Kelly.
My question somewhat for Peg. I was speaking with a physician and she was specifically talking about nurse-family partnership and just the challenge that the nursing profession is faced with right now, and the relationship that nurses typically have with patients being not necessarily conducive to being home visitors. And I'm wondering, that feels like a very different strand of home visiting, the nursing piece, and I'm wondering, does it make sense to have some sort of convening of people within the medical profession to talk about like how the system can support this within the profession? Or I don't know, it was interesting hearing from someone like yourself who's internal to what she saw as potential challenges. And she was sort of like, my patients don't know that this is an option and they don't necessarily have a relationship with their nurses whereby they would ask for it. So I was curious. And I guess it's for everyone, but particularly Dr. Miller.
First of all, I don't, it certainly doesn't have to be a nurse. I think that's one model that works really well with certain people. But I think one of the goals of this is to allow families to be educated enough about the options that are available to them to choose what model works best for them. Oftentimes, if we can kind of get in the door, again, establish that relationship, and then have whatever the training of the home visitor is that initially sees them, maybe that's not going to be a long-term relationship, but it's a caring, sort of trusting relationship long enough that they get in the door, and maybe a nursing relationship is not the best. I will tell you, there's a lot of nurses since COVID that are eager to get out of nursing per se, but still want to use that background and enjoy that education component that goes along with nursing. And so home visiting, I think, would look attractive to a lot of people that are choosing to change the focus of their nursing career.
Wow. Don't tell the hospitals that.
Yeah.
Yeah, well, the deal is that's where we need HEC, right? We need to train more nurses.
Good point. Good point. Wow, great question, Kelly. Okay, other questions, comments, and I know we are running behind our next one. Okay, Christy, thank you very much for putting the presentation together and for all of your work on this. Council, we will be obviously talking about this a lot in the coming months because we are going to be a real key in keeping the momentum going. And I think that like one of you brought up about when we've got our agency directors with us, it will be a great time to talk about this and make sure we're all in this together. So that is definitely a role the council can play. All right, we need to move over to rules. Thank you.
And I'm wondering, because we have sort of 10 minutes left in this section, do you want them just to come back for the second section and try to, I just don't know. And maybe I'll leave up to Kayla and Jordan, like how much they can do in the 10.
Well, I was going to suggest that we council, we run out of time at every meeting, so this is going to be a conversation we're going to have again. But I was going to suggest that we all just start eating our lunches and give Kayla and Jordan 20 minutes now and do this, if you guys don't mind doing it that way. And then we'll just eat and then we'll take a shorter lunch break. We have to start at 12:30 for our panel. I know that's a certain start time. But if you're okay, council members, I'd like to suggest we do that.
We'll probably make too much noise for them, but
Right, we'll try to eat
Well,
quietly.
I can put us on mute.
Okay.
Unless we have a question, I'll unmute.
Thank you both for being here. Sorry for the delay again. I know you're getting used to that, but sorry, seems to be a constant. And we do have your slides, your presentation in our packet. So hopefully we've seen some of that, so we already have some background. But welcome to both of you.
Thank you. And thank you so much for having us. We know that you have a lot of content to go over, so we just appreciate you having us here to kind of go over the very lengthy rule set for employment-related daycare. So Remy, were you going to share the slides on the screen or?
yes, I can share the slide. Oops.
This takes me a little bit longer to pull them up when we're in person because I don't have my 3 screens that I'm used to at home.
Totally.
Yeah.
I'm just going to jump in on over you for a second. Jordan, I think given our limited time and foreshadowing a little bit, Sue, to perhaps being tight on time later, I think as many of the slides as we can get through, let's try and power through in our 20 minutes.
I agree. Okay. So again, thank you. My name is Jordan Parjetter. I'm here with my colleague, Kayla Westine. You've seen us before, and thank you so much for having us again. You can go ahead and go to the next slide there, Remy. Thank you. We can skip over that slide as well, because that's just the agenda. Okay. So we are here to kind of talk about the transition of employment-related daycare rules from the Department of Human Services to the Department of Early Learning and Care. for these presentations, we've talked about this before, but for these presentations, we'll really be going over kind of on a high level content review. We won't be looking at the rule language specifically, but really around the high concepts that govern ERDC and how the program functions. One thing that we wanted to mention, though, just to make sure we're all on the same page, is that in transitioning ERDC from ODHS to DELC, we really have to do kind of a cut and paste movement where ODHS is repealing their rule set completely for ERDC, and we're adopting that same rule set with minor edits. So the only edits that are really being made to these rules are policy changes that are through House Bill 3073. And we'll call those out specifically where there are changes, and then just minor kind of structural differences, kind of where things live within the rules. We really want to make sure that we're not making huge substantive changes right now because we want to make sure that there's continuity of service for families and providers. We know that even though ERDC is moving as a program from one agency to a whole new agency, we want to make sure that for families and providers who are needing to access, assistance with childcare costs or payments on behalf of eligible families, we want to make sure that everything that they experience is as seamless as possible and that there's no loss to access to those benefits. So the rule set that we're going to adopt through DELC will be including all programmatic features, as you see here, and then there are about 150 ODHS rules that are being pulled over. Do you have anything you'd like to add to that, Kayla, before we move on?
Nope, let's keep going.
Great. Okay, we can go to the next slide. Thank you. Great. We kind of already talked about this, but we're really going to be trying to preserve the status quo as the program exists today while we're transitioning it from ODHS to DELC. So really just maintaining continuity of services for families and providers. As we already discussed, large volume of policy and rules are being transferred, minimal changes made, and the only ones that are being made really are legislatively required and will be called out. We'll make sure that you are very aware of what those changes are. We have staff in both agencies that are really working on handling different aspects of this transition. And then as a very large reminder, one of the other key reasons why we're not looking to make huge substantive policy changes right now is because ERDC is going to remain a part of ODHS's one eligibility system where other self-sufficiency programs and medical programs lie. And any changes to policy, to Oregon administrative rules, nearly always require that there are changes to the system, and those changes can take time in terms of getting everything done within the system. So we want to make sure, again, focusing on continuity of care, that right now when we're working on this transition, that we're really keeping the program as it is so nothing breaks in that process. We want to make sure families have access. Okay, I think we can go to the next slide. This is just a general timeline. We've looked at this before, so I'm going to kind of just let that be there for a couple of seconds. But today we're going to be talking about some elements of rule, including definition, ERDC households, the application process, and decision notices. And then we'll be going through other areas in the future. One thing I do want to call out on this slide, though, is that we do have the information sessions scheduled. Those are open to the public on February 23rd and March 2nd. I believe that you've already received information around that, but wanted to flag those as kind of ways for the community to engage in this process as well. Kayla, I see you're on mute.
Yeah, just a little bit more context. So the 23rd is tomorrow. So we'll be having our first one, with almost in 24 hours. The goal of the information sessions is to really sort of talk through, hey, here's ERDC. Why is it coming to DELC? What does it mean that it's coming to DELC? And also, what does it mean for DELC to have policy-making authority, like true policy-making authority, of ERDC while it's still in sort of a shared administration construct between ODHS and DELC. And so those first two sessions are very open to anyone who wants to come. The link's up on the website, and it's sort of an orientation for the public, community partners, families, whomever, to sort of say like, here's what ERDC is, and here's how it's moving and what that means for potentially you. And then that information is going to flow right into the RAC, so the rulemaking advisory committees, which will be the 9th, the 16th, and the 23rd. Those are joint RACs between ODHS and ELD. The first one will be several hours long. In fact, all day on March 9th, to review the numerous amounts of repeals and amendments that ODHS has to make to their Chapter 461. And the following two meetings, the 16th and the 23rd, are to review and talk about, well, how did DELC construct a rule set out of the pieces that we talked about on the 9th, right? How did that come together? Those are also open to anyone who wants to join, but you just have to sign up. That sign up link is on the website. We're happy to recirculate that information after this meeting, Sue, or if anyone else feels like that would be helpful. But just wanted to say, like, this is our big opportunity to really say, like, hey, public, hey, community partners, ERDC is coming to DELC. Here's what it means for you. Here's how to interact on a policymaking basis with ERDC moving forward. Here's our rules, and here's like what our legal parameters of this program are going to be. So just wanted to like tee that up pretty blatantly. And if there are questions, happy to field those offline, which I think is probably the best way so we can keep going, Jordan.
Agree. Okay, I think we can go to the next slide.
Yeah.
Kayla, let me take you up on your offer to.
Yes, ma'am.
Sorry, to resend the information if we have already received it. And then I think we can use our own networks to also send it out. Cully, I'm thinking specifically of the coalition, of course. They may already have it on their radar, I don't know. But so that would be great. And we appreciate you really doing that kind of outreach and communication, because that's going to be key to make sure the rules we adopt are known to the public.
Yes, you'll have it by our second segment. I'll make sure that gets to you by the time we come back.
Okay. Thank you, Kayla. Okay, Jordan, we're back to you.
Great. Okay, Remy, I think we can go to the next slide. Thank you so much.
It's not behaving the way I want it to. No,
There we go. Great. Okay, so we're going to cover two different segments of rule during this portion. I know we have very little time left, so we're going to go ahead and just kind of zoom through. So the ERDC rule set right now, it contains more than 45 definitions, and those are all kind of definitions for words and terminology that kind of have impacts to the program, application, eligibility, et cetera. There are a lot of those rules or a lot of those definitions, and you'll have the opportunity to look over all of them, but we wanted to take a look at just the most important elements for the program and kind of review that with you. So we have here, there's the caretaker within the program. We have elements here, and you have these in your packets as well. But kind of what the definition says within rule, which is that they're responsible for care, control, and supervision of a child continuously. And then also why that's important. Why is this important that it's defined within rule, and why do we want to keep it when we're moving it over to DELC? For a caretaker, this is really important because it's central to how a family is considered eligible in the first place. A caretaker is the primary applicant for ERDC. They're usually, you know, they are the ones who are applying for ERDC benefits. And so they're crucial in terms of defining that role for who is able to apply, who is sort of the head of household. Is another terminology that's in rule. The next one we have here is child. This is an individual that's under age 13. I do want to note that if their benefits are approved when they're age 12, even if they turn age 13 during that certification period, their benefits would still remain. So they would still be eligible for childcare coverage for that full 12-month period that's central to ERDC. And then also under age 18, if there's a demonstrated need And that really is just sometimes due to special needs that might exist, diagnosed disabilities, or there might be situations where parents are requesting care for other reasons, such as like living in an unsafe neighborhood where they don't feel okay with their child walking home from school alone. And so they want to keep them in a childcare facility, etc. This is important because it's really central to eligibility and amount of benefits a family receives. The next piece here is countable, and that is a term that kind of talks about income or resources and what is actually being used to determine a family's eligibility, their copay amount specifically, and whether or not they meet income requirements. This is important because there are countable and excludable forms of income and resources. There are some things that families might receive, such as, for example, like foster care payments is one of those areas, or adoption assistance payments, earned income of a child. Those are all not countable things when they're looking at a family's income. And so there's different treatments of different forms of income that you'll have the opportunity to look over in the future. And lastly, categorical eligibility is a new definition that DELC is creating actually as of July 1st. This is something that creates eligibility for a population based on select criteria, regardless of most other criteria. So it's important because, as you can see here, it allows certain populations. So real tangible example here is TANF recipients to be eligible for ERDC regardless of most other criteria. And that's really talking about some upcoming policy changes to ensure a truer 12-month eligibility period for those individuals who receive ERDC, lose their job, and apply for TANF to allow them to continue to have their childcare paid for through ERDC by making any family that receives TANF categorically eligible for employment-related daycare. And Kayla, go ahead and fill in the blanks.
Yeah, so I just wanted to flag that Jordan has framed this perfectly, that it's related to the sort of expansions that will go into effect in July. I just wanted to maybe preemptively address why we say most other criteria. There are still a select few CCDF requirements related to making sure that you've either had your child immunized or have made a statement about why you're waiving essentially the immunization, and some like not surpassing income or resource thresholds that are still applicable from a CCDF funding framework. And so I wanted to add that little clarity about why it says most other criteria. We're talking about those select tiny few federally required pieces and not these sort of state policy, this income type is included, but this one's excluded nuance. We're very high level in terms of the most other criteria being excluded.
We're running on to it. I just want to add one little bit of emphasis on this piece, right? So I know as the team has emphasized, we're for the most part really focused on continuity so that the things work on July 1st. This is one place where there is a substantive policy change that's happening July 1st. And part of what this allows is that it will mean that ODHS won't be put in a position where it has to sort of maintain a separate child care assistance program for TANF families. I think it has some other benefits along with that. But I think what it allows is just a much more seamless working of ERDC with TANF as ERDC is moving into DELC. So I know they have precious little time, and sorry for interrupting, but did want to just highlight that piece here.
I also think, David, not to extend Sue, but that is also a perfect example of the type of collaboration and sort of partnership that will continue to be needed between ODHS and DELC on policy-making choices that impact other programs in the self-sufficiency suite and also within one. I think that's like a quintessential or an archetype of those types of changes to be on a enterprise-wide lookout for.
Absolutely.
Yeah, good point. We're going to stay connected to ODHS for the foreseeable future.
Yes. Okay, I think we can go to the next slide. The next segment of rules is really around tiered groups for eligibility processing. This can get a little bit confusing, so we're going to keep it very high level and just kind of bird's eye view here. So ODHS established kind of a grouping structure, and you can see this funnel down below of household, filing, financial need, and benefit groups. It's sort of gets smaller as it goes down because individuals sort of fall out of different groups depending on where they're at within the application process or the eligibility determination process. It's actually quite simple for ERDC because ERDC's filing group becomes the financial group, becomes the need group, becomes the benefit group, which is far simpler than many other programs. There are others that have really complicated kind of tied together rules for each of those. However, in moving the rules over for ERDC, we wanted to keep the same structure because that's how it is programmed within one. So we don't want to mess with anything that's already programmed into one regarding like a financial group or a need group, even though those groups are the same as the filing group for ERDC. And really what this means is that the filing group is really the individuals whose circumstances and income are used to determine benefits for ERDC. Do you have anything to add on that, Kayla? No? Great. Okay, I think we can go to the next slide, which is just questions for these segments of slides. We do have others later today that we'll be presenting on, 2 more role segments, but wondering if there are any questions we haven't already addressed.
Any questions?
So as I understand, there's going to be a rulemaking group that is going to take all of those principles that we just learned and really go down to the specific rules. Is that the way it's going to work?
I'll let you guys know. Yes.
No, David, please go for it.
So again, most of this work right now is just out the various rules related to ERDC that are sort of currently deeply integrated into ODHS. So Jordan, Kayla, and a bunch of colleagues at ODHS have really over the last 6 months been doing that work to pull out those rules so that we are able to do that. We will, be engaging the public so that, and we'll have a formal RAC. I think it's likely that we'll hear things that feel like good policy suggestions that we can't do now, but you as the council will remain, will continue to have rulemaking authority as the early learning over ERDC rules. So this is not your final go at these rules, but again, the priority is to really just make sure nothing breaks on July 1. So this is, to be honest, mostly a technical movement of the rules at this point.
There's not new rulemaking.
There's a tiny bit associated with the changes that were mandated as part of HB 3073 that will be going into effect. So I think that those new rules are really that aren't currently in place are really the ones around the 12-month eligibility and the TANF categorical eligibility are really what will be different from what's in place in rules as of today. And Jordan, Kayla, correct me if I got that incorrect.
No, I was going to put a crude analogy on it, which it's almost like you're buying a house, right? You're going to get the bones of the house and the kitchen and the bathrooms that it comes with, right? And then once you close, you are free to do what you wish and move in, right? And in reasonable sort of constraints. But that's sort of the way that the transfer is working, right? Like you're sort of getting what's currently there with a few select and known expansions.
Okay.
But as the council, as the rulemaking body, you are still responsible. You still have to vote on all these rules.
Yes.
Even if we're asking you to really move them at all to make this change. So we just want to make sure also that you know what you're voting on, even if we're not asking you to make changes at this point, if that makes sense.
We appreciate knowing what we're voting on.
Yeah.
Peter,
Peter has a question.
Yeah, just real quick. I know every change in one takes time, but I want to just keep nudging about the change that will allow families who are looking for work to be able to access ERDC. So if there's ever a report you can give on the timeline for changing one so that families who are looking for work could access, that'd be great to know.
Okay, we'll take that back and see if we can come back with a firmer a plan around getting to a timeline. And David, I see you're starting to jump in.
I just won't answer your question specifically, but one thing that we are planning on bringing back to you next month is we have actually been sort of working on a flow chart on what will the process look like and what are all the steps for making policy changes to ERDC in the future, including where in that timeline are there opportunities for community to engage, where there are opportunities to engage with council. Because I think one of the things that we've also really learned in this phase and also really want to map out clearly with you as well as because of all the steps involving one ability in the mainframe systems, we don't want to engage community partners and we don't want to engage you as the council at the rulemaking stage. We need to engage you before then, because once you start to engage with the IT system, you do start to lock in policy changes. So we've been working on a map to really think through how do we meaningfully engage both community partners and yourselves in those policy questions well before we get to the rule conversation.
Definitely.
Why did I think that had already been addressed? Looking for work. Is it just because we've talked about that before, but I thought that was in there. Allowed.
It is allowed. It is the one system has been set up to process it. We need the one system to process people.
We haven't introduced yet that is a policy change. So I just think that is something that could be brought to the table in the future. But I think it will also be helpful to sort of map with all of you what that policy change process is going to look like, because it is multi-steps.
Okay.
I do want to add, I guess, too, that I think with the expansion of allowable eligibility for ERDC for TANF recipients, there are going to be a lot of people who might be seeking cash assistance who are looking for work. And one of the great things about that policy change as well is that it's not directly tied to jobs program participation. And so even if they haven't been able to set up like a jobs plan with their family coach or anything like that at ODHS, they would still be eligible for a part-time kind of amount of hours to start out. And then if more hours were needed beyond that, we could increase it to the full time. So I think that might help a little bit. I know it doesn't directly answer kind of the call for that policy change.
Yeah, thank you, Jordan. Good point. That will help for sure. Okay, we need to wrap it up and take a 15-minute real break. Thank you both very much. And I think we're going to see both of you again at 1:30. Right?
Yep, All right, take care, everyone. Thank you.
Thanks, Jordan. Thanks,
Thanks, Kayla.
Curiosity, how many rules are we going to be approving? And are we going to do them one at a time, or is there going to be like a batch?
So the ERDC new proposal, and it's on that timeline in the slide deck, that will come together in June. But
Yes.
oh, sorry, I didn't realize you guys are still there. Go here. So I'll let you answer that.
They'll come to you. I'm sorry, I couldn't tell which council member asked that question. They'll come to you as batch. You'll have, I think, months to see them in advance. You won't just see all of them in June. We're talking about realistically in the ballpark of 40, 50 individual rules. It is a more voluminous set than I think typically comes.
We'll make a package.
We'll make it.
Digestible.
Yeah, I think Jordan and I have a little work to do on some like memos and key points, and I think this is a little bit of the reason why David's trying to drive home a little bit that we're inheriting something that, though, even sometimes looks like we might be able to change around the edges. Like, for instance, the group structure we just went over. The group structure is highly intertwined with how the one system operates. So even thinking about changing around any of those words has systems impacts where you would just sort of be out of alignment with your rule set and how the system operates. And so it's going to feel like a lot of rules, and it is a lot of rules, but also the flexibility and sort of what's been written isn't huge.
And I think in some sense, what I would describe Jordan and Kayla doing today and for the next couple of meetings, in some sense, walking you through the table of contents of the rules, right? So that, so not going into everything that's in each of those sections, but so that you would understand the structure of the rules and the kinds of questions that are addressed in it.
Yeah.
Right, we're doing this piecemeal over the next 3
It would
months.
be nice if there was a way to give communities a chance, maybe through the hubs.
Okay.
Just to provide input or observations as before we solidify everything.
And I think that's part of what we're also doing with these listening sessions, with these sessions, right? Supposed to provide information, but I think
If
opportunity.
there was another,
Yeah.
in case they can't make a
Yeah.
session, because a lot of providers are busy. So, but they have like the hands-on experience with how this works or doesn't for themselves and for the families they serve.
Look, David, why don't I take that back and see if I can sketch out something with Carmen?
That sounds great.
Okay, I will do that. We'll put that on our to-do list. And Sue, I've already sent out the links for the sessions to Remy, so she'll pass them on.
Okay, thanks. Kayla, will those sessions be taped?
Yes. I'm not sure how to post them, but we will get them posted. I myself won't be doing it, but we'll tape them.
Okay, so providers could go on and listen to them after the fact to get them. Okay, perfect. Thanks, you guys. We'll see you at 1:30.
Thank you.
Okay.
Okay. Yeah. I know.
Okay. And we're back.
Thank you, Remy. By the way, your screens are fabulous. I just want to thank you for that.
Oh, thank you. Yes.
Yeah. All right, good afternoon. Oh, yay. Look at all these wonderful people on this call. Okay, we are reconvening. Sorry, we're 3 minutes late, but we are really excited to see all of you. Yes. So council, I probably don't need to give you a lot of background. I'm going to have the panelists introduce themselves as you speak, if that sounds okay. And we know from our agendas who you are and where you're from. And we will listen to all three presentations, and we have some information in our packets. And then we'll open it up for discussion after we hear from our panelists. So I just want to set that stage so you know we will have a chance to interact with them. And we had a really exciting update from our home visiting system committee earlier today, this morning. So we are primed to listen to what you all are doing with parenting education and home visiting systems. And I know we're going to start with you, Shauna, so I will invite you to lead off. Thank you for being here.
Thank you, Sue, and thank you to the council for inviting us. Thank you also to my colleagues who are here presenting and sharing the space with me today. I'm Shauna Tomini, my pronouns are she, her, and I am calling in today from Oregon State University, where I'm an associate professor in human development and family sciences. OSU sits on land forcibly taken from the Kalapuya people. I do want to acknowledge that in this space. And I have the honor and privilege of supporting the Oregon Parenting Education Collaborative, which I'll refer to as OPEC. And those of you who know me and who have been in spaces with me before know that I'm a storyteller, and I like to carry the words and stories of others along with me. It's been a long time since I was a parenting educator and home visitor myself, and even longer since I was an early childhood classroom teacher. And so I try to spend time really listening and leaning in, both through my professional work as well as volunteer work in my community and as a parent myself in our local schools, in listening to those voices and looking at how they inform our work. Because as we move farther away from being in those positions ourselves, we have to listen to really understand what's happening. And today, I'm hoping to leave you with a story of hope, but I'm also starting with a story of sadness and of heaviness that I don't often bring to kicking off a meeting or starting with, but it is the feeling that I'm coming in with. And it comes from a moment last week. I was talking to an educator who said, in my 20 years of teaching, this is the first time that I have ever felt like I could not trust the children in my classroom. And hearing those words, my heart sunk, because what does that mean for that to be true? And for this educator, she went on to talk about that the challenges and the behaviors that she's seeing in her class in terms of emotional expression and behaviors and what's coming out in new and different ways than she has ever seen before, also in harm that children are causing to one another in the ways that some of those big emotions and feelings are coming out. In the distrust that she's feeling even among families or between families who are stepping back into spaces together. In so much else that feels like she is carrying as an educator. That she made the statement that nothing feels predictable anymore. And I've heard the same thing carried by families who are talking about just the extreme stress they're carrying and the extreme stress and anxiety they're seeing in themselves and even their young children, the isolation they feel, these mentions of, well, some of the things we learned from the pandemic were who our people are, and that we turned inward, and we had to, for our own physical safety, to step back and step out of physically social spaces to protect our well-being and the well-being of others. And that has come at a detriment in some ways to what we know about physical and personal and social connection. That time and this trauma of the pandemic that we are just beginning to understand the impact of is coming with now trickle out effects in terms of both our own anxieties and mental health challenges. We're seeing rises in anxiety, depression, and in isolation, as well as the fear of many folks to be back in those spaces. And when we think about what the research says about what folks need to be resilient, when you face something that's unknown or unexpected, social support, social connection, the abilities to connect, to have communication skills, to ask for and communicate what you need, to problem solve, and to have people you can turn to do that together, and especially as parents. Because as parents and caregivers of children of any age, what we want for those children is to see a world where our child is valued, supported, loved just for being who they are, for all of their aspects of their identity, for their experiences. And we need that for parents too. As challenging as it has been over the pandemic to provide that for parents, or to pivot and get into virtual and digital spaces to do that in new and creative ways, the story I carry today of hope is in leading by example today, in telling the story of where we are with the Oregon Parenting Education Collaborative, or OPEC, as I shared, and you'll get to hear other stories from my colleagues today as well. So that hope of looking at what do we do in society, both to help parents and family members manage what comes up, no matter what, because we know, especially from the pandemic, that we cannot always expect what is coming. We just don't know what's around the corner at all times, but we do know that we can build resilience and capacities for resilience to meet those unknown challenges. OPAC hopes to do that and hopes to continue doing that and strengthening the ability to do that for, with, and alongside of families. So OPAC, as many of you may know, but in case you don't, has an aim to be a part of fostering that community for and with families, giving them the gift of community while we have that place for skill building and support, and finding strength in other families and their stories and connections with other parents who are doing the same or going through the same things that we may be ourselves. OPEC was created with a vision of becoming a statewide system of support for parenting education at a time when the state did not yet have that home. OPEC has been a long-term partnership between 4 philanthropic foundations and Oregon State University, including the Oregon Community Foundation and the Ford Family Foundation, who also provide significant governance support for OPEC, as well as partners at Meyer Memorial Trust and the Collins Foundation. OPEC also includes a statewide network of parenting hubs aiming to destigmatize, normalize, and expand access to free parenting resources, classes, series, even parent coaching now, which has moved from just being in person to also online or hybrid with the pandemic. We've done a lot of learning and growing, as well as community events that uplift and elevate families and help caregivers be the parents they want to be. OPEC programs are for all families and strive to build community while honoring each family for their values, identities, home language, culture, and lived experiences. The OPEC hubs, as I've mentioned, they provide infrastructure across the state to support parenting education locally and regionally, serving as that go-to place for families and community partners related to parenting resources and programs. They support local professional development opportunities for parenting education professionals and collect and report on data. They also foster community collaboration to coordinate parenting programs from across partners and build cross-sector relationships to bring everyone to the table so that they can avoid duplication, make sure as many families are being served in the ways that they need to be served in their communities, and to leverage those available resources across communities in creative ways. And finally, they expand access to parenting programs through a combination of direct service, mini grants, and contracts with partners to meet families in their communities. Not only do hubs support their local communities and regionally, they support one another as a network and as a community of support. They truly create a statewide community for one another. At Oregon State University, our team has the pleasure and honor of supporting OPAC and OPAC hubs as part of that governance team, and by offering technical assistance and strategic planning support for hubs in small groups or large groups or one-on-one, We also support a statewide professional development system for parenting education professionals. And that's critical because we must serve and support those who are supporting and building the community for families. Our statewide system of support for parenting educators has grown to include regional and online curriculum and facilitation trainings, learning communities, an annual conference, and more. So we're aiming to provide a home for the professionals doing this work while they provide that same support in their communities to families. We also house a robust reporting system with ongoing evaluation of all OPEC programs, and we work closely with foundation partners to support governance as well as state-level partnerships. And it's these that I'm very excited to give you an update on. So there is a lot here. Let's walk through it together. So the seeds in that first quadrant planted by the OPEC Foundation partners from their long-term investment, you've seen a timeline that I've shared, have grown and matured in a way that OPEC has spread from an idea and small grants and small partnerships over time, dating back in the early 2000s, to establishing a network of statewide hubs, which reached statewide by 2020, 2021, when those hubs launched officially in 2010. So this was a long process just to get a statewide system of hubs established with funds to support that coordination and some of that early work around getting programming out and normalizing and destigmatizing for families with young children. With coordination, evaluation, professional development, and established partnerships in place, OPEC became ready to expand and had the pieces in place to serve as a strong state partner to better meet the unmet needs of Oregon families. The first expansion came with partnership from the Oregon Department of Human Services, Self-Sufficiency Program in particular, in support of expanding parenting education programs for families who had older children and adolescents, as well as the capacity building support for curriculum trainings, facilitation support, workforce development that was needed in order to do that well. Alongside with that, we then established a formalized partnership with Oregon's Early Learning Division through the Student Success Act, which specifically named partnership with OPEC as a foundation-led coordination system for parenting education and mentions in Raise Up Oregon around parenting education and dedicated funding to expand parenting education programs and services to families with young children. We've also launched a new initiative together as part of this work with the Early Learning Division, or soon to be DELC, around parent family voice and leadership. And we are starting to build and create the technical assistance plan for hubs, both OPEC and early learning hubs, around their parent family leadership councils to bring folks together in community as a community of learners and to expand access to resources to support them in those efforts. And we have an exciting new partnership on the horizon that was just approved. We are working through the intergovernmental agreement process, so we're still in that paperwork process with the Oregon Health Authority to bring in federal CHIP funds. Those are from the Children's Health Improvement Program funds that we will be able to match 3 times over with the Early Learning Division dollars to bring more funding support into our system to significantly expand the offerings, both the coordination support, the professional development support, and the programs needed to continue to meet the needs of communities in Oregon through this multi-sector partnership, which is pretty incredible. Through these partnerships, as they've gotten off and running and we're still continuing to grow them, we're already seeing greater numbers of families receiving access to and participating in parenting education programs. You may have seen some of the numbers that I shared. Hubs are able to diversify their offerings to better meet the needs of families, linguistically, culturally, racially, age-wise, specific populations, and that's an area that we're hoping to continue to grow while also building our statewide partnerships in other ways. Our evaluation and research data show significant positive outcomes in parents feeling more connected with their communities, better able to manage parenting stress, increase communication skills, and strengthen relationships within their families as well. Hubs, just to put in some capacity building statistics here as well. These partnerships together, through these partnerships, we've been able to expand the number of folks who've been trained in curricula, whether it's evidence-based, culturally responsive, culturally specific, promising programs, and hubs have leveraged a tremendous amount of funding in their own communities to further these efforts as well since the beginning of OPEC. There's still a long way to go, and this work takes time, as you will have seen in the slideshow that I shared. And I was reminded that by our partners that I started the timeline, or our team started the timeline in 2003. It actually dates back much earlier than that, with grants from the Ford Family Foundation being offered in 2001, and even other partnerships before that. But this is meant to serve as a reminder of the time it takes to meaningfully build trusted relationships and systems. This work hasn't happened overnight. It's still growing, it's still maturing with time, and it takes that time to do it really, really well. A few other notes about what we have seen as some of the success of OPEC has been that time and that grace and that flexibility to really listen and learn and take a strengths-focused approach to supporting hubs and trusting them in their work with their local communities, and seeing our role as being those listeners and learners along with them, to be their advocates and supports, and to bring what they need and identify in their communities. We're also finding that this work takes flexibility and adaptability. The blending and braiding of foundation and state and federal funds has been critical. We would not have had the same flexibility without being able to really strategically look at what are each of the pieces of the puzzle that each of these funding streams and partners can bring to the table and help us put together to meet the real needs of hubs and communities, and thus families and communities. And finally, this work takes modeling of the values we are teaching. State systems, even all of the systems and institutions that we are a part of, have done things a certain way a very, very long time. And certain families have been able to access those resources and to be a part of that and to be a part of those stories, and others have not. And that came up again with a rise of attention to racial justice and inequities in our systems during the pandemic, which none of that was new. This has been talked about for a very long time and experienced for generations. We have another opportunity again to really look at the systems we have, how we are creative, how we are flexible, how we really listen and model these skills to elevate those voices who have been institutionally marginalized, and bring them, not just bring them into our system, but question the way that our systems have always run, to do things in new ways that really go hand in hand in partnership with parents, with families, and with children, and create a system of support that stands alongside them and offers power with them rather than over them. So thank you so much. I know my time is up and I could speak quite a lot longer about all this, but I'll look forward to the discussion afterward as I hand over to my friend and colleague, Maria Weir.
Thank you, Shauna, so much. You may have seen me nodding along a lot with what Shauna was saying. We've worked together a long time and everything was resonating. I'm going to start with a brief intro of myself, and then an equally as brief intro of Building Healthy Families before I launch into my meat of my topic. So my name is Maria Weir. I am the Executive Director of Building Healthy Families way out here in Eastern Oregon. I am joining you from Enterprise, where it's probably colder and snowier than it is where you are. This work and this whole Raise Up Oregon plan is really personal to me. I've been teaching alternative high school education for 21 years and have kids where every goal and objective and strategy I read in this plan somewhere along the line seemed to drop off, or there was disconnect. And I'm not trying to work myself out of a job, but I'm so excited about this work because even today, I'm in the classroom until noon, as I was sitting in the classroom, I was just thinking, if this piece of the plan would have happened, or if this would have happened, maybe this kiddo wouldn't be here right now. Building Healthy Families, I'm also the director, so I refuse to leave the classroom. So I'm in the classroom in the morning, and then I'm the director of Building Healthy Families in the afternoon. We are a nonprofit that does early childhood education, parent education, and positive youth development. We are the OPEC hub for Wallowa, Baker, Malheur, and starting in July, Union County. So if you look at the eastern side of Oregon, just from top to bottom, there we are, a very geographically diverse, but also very culturally diverse region. And you know, we really try to integrate parent education into absolutely everything that we do. My tie-in with this is just like multi-folded. We are an OPEC hub. We've been an OPEC hub since the inception of OPEC. In fact, Shauna was talking about some of those earlier grants. I think Building Healthy Families had their first parent education grant in 2001. It was called the ESPP2 grant, which is embarrassingly enough, you know, I was here, I was doing the work. And so we had those first grants to do parent education. We also have run a number of home visiting programs throughout the 15 years that I've been here. We've been the Healthy Families of Oregon for our region. We no longer hold that contract. We still do hold the Family Support and Connection contract with the Department of Human Services. And it's been very exciting to me over the last 5 or 6 years in particular to see this coordination between home visits and parent education. I don't know if you all know Lawrence Piper, but I remember when Lawrence and Shauna and Mary Louise and I were all sitting around the table trying to figure out how can we integrate parent education into these home visit programs and how it would benefit and how it would value. So I think I'm here because I'm still on the ground. Not only am I in the classroom, I still facilitate parent education classes. I still support staff and train them in home visits. When you live super off the grid like we do, you wear 11 hats or 20 hats. I don't know, you do lots of things. So I feel like this is very fresh and very real to me. And so I'm hoping to bring some stories and some power that I've seen behind coordinating these systems. So I'm going to speak specifically to Family Support and Connection, the ODHS program. It's mentioned on its very own as a strategy in Raise Up Oregon to expand that service. And we've just started our expansion, which I'll speak to in just a minute. Like I said, about 6 to 8 years ago, we started implementing evidence-based parent education into our home visits. And so every week we would take a lesson from a curriculum and we would go over that in 15 or 20 minutes of the actual home visit. We would find a way to balance that with connection to resources, building family goals. But what we found is that a lot of these families were in crisis and they weren't able to take just a few minutes to talk about their relationship with their child or how to build upon those strengths. And that we had an audience. Their kids were either at school or at daycare, or we had somebody to kind of help entertain and model. Shauna talked about modeling. We would sit down, or my home visitors would sit down on the floor with that family and their child and spend 5 or 10 minutes engaging in reading a story, engaging in an age-appropriate activity. And so we really saw some pretty incredible things happening, but we also heard some incredible things happening. We heard families saying, these skills that you're giving me, I'm remembering these when you're not here. Or these 10 minutes I'm spending connecting with my child have bought me so much in terms of behavior and management. So we really started those conversations around how do we implement this on a bigger level. Healthy Families of Oregon had several evidence-based curriculums that we were using. And I just think it makes parent education so much more accessible. We will often get a call or a referral from our community partners in the medical clinics who will say, we had a parent here, they brought their children, they need some support. And then we can reach out and we can offer individualized home visits using OPEC funds, or now using these early childhood funds or using ODHS funds. And then our goal would be is maybe one day these families would be ready for a group series or a parent-child support activity or a community event so they can build that network that seems to be missing for so many people of other kids and families. Again, I think this also provides almost a one-stop shop for families when you have a home visitor. We were a CBO that was funded during COVID, and through home visits, first virtual and then maybe outside and then in the home, we were able to provide a connection to resources, but also some very tangible, concrete resources. Here are some diapers to get you through the week. Here is some laundry detergent. That helped us build trust with a family. But as I look through the Raise Up Oregon plan, there are very few objectives that I can't link to home visiting and parent education. You know, I pulled out a couple of really concrete examples, but when you're trying to identify early learning disabilities, we're able to find those with home visits. Home visitors are trained, parent educators are trained in ASQs. We're able to deliver those, and we're able to gently bring up the topic with parents once we have a relationship built. So I get excited when I look at this plan, because I think it's wonderful. It is so holistic, so all encompassing. I love how much I see parent education and home visiting ingrained in there. And I really do believe those are two of the key models that we can use to integrate all of this work together. I was told that you guys wanted some ideas and some feedback on the plan. And so just a few things that I felt, I don't even want to say we're missing, but I think are good things to think about. It was good to hear that you heard from the home visiting committee this morning. I was on that work group. And so it was really fun to get together. And one of the things I didn't see, and maybe I missed it, but called out directly, is the professional development for home visitors. Home visiting is one of the toughest jobs. You're not only a parent educator, you're almost like a social worker without a social worker background often. And so some coordinated professional development, especially if we make a unified, streamlined home visiting system, so that, you know, people are getting support from their home visitor that's universal and that has a common language, but also those home visitors are feeling connected and supported because there's such a high rate of burnout amongst home visitors. One of the other things is there was a little bit of integration, but really the integration between home visiting, parent education, and our medical partners, both mental health and physical health. We have had so much success here in Eastern Oregon with working closely with our medical partners. I remember years ago at an OPEC convention when we were trying to think, how do we get our parents to come to Parent Ed? Who in the world do they listen to? Because they sure as heck don't listen to, hi, I'm Maria, I'm a parent educator. And we decided they listen to doctors and often they listen to teachers. So the connections to the medical community and also the K-12 community, I know that the focus of this plan is prenatal to 5, but I think of our Head Starts, our early Head Starts, most of our schools are now running pre-K or kinder transition programs. So that was another piece that I didn't know if we wanted to call out. And then finally, the workforce delivery, the workforce training. We run an early Head Start here, and finding staff to be lead teachers, highly qualified teachers, finding home visiting staff, finding parent educators. How do we build that workforce? And are there ways to do it organically? Are there parents that have received home visits, or are there parents that have participated in a parent education class who can take their firsthand experience and have some kind of a track where they could see this as a goal for them? I could be a home visitor. My home visitor empowered me so much, or I could be a parent educator. And so just really all these strategies are phenomenal. And I can only imagine what my high school kids would look like if these were all in place, but how do we sustain it and how do we keep it going? I am wrapping up. I'm very excited for our question and answer time. I do want to hand it over to Kara. I love relief nurseries. In fact, our Malheur County office is in the Treasure Valley Children's Relief Nursery, and it's such a natural place for partnerships. And so I was thrilled that she was a part of this conversation and that she was able to explain the phenomenal work they do. And so I will let her share her story.
Thank you, Maria. Welcome, Kara.
Well, good afternoon, Chair Miller and colleagues. I also was nodding along with everything that both Maria and Shauna have shared because it really resonates. About 6 years ago, when I was running a relief nursery in my local community and managing a Healthy Families program, I accompanied a home visitor on a home visit. We pulled up to an apartment building where we were there to visit a 16-year-old mom and a 6-month-old baby. We walked up these cold stairs and into a very small apartment where there was only room to just an aisle where you could walk through the hallway because this young mother's, her own mother, who frankly was about 35 years old, she was a hoarder. And so this teen mom is living in incredible conditions, but we make our way back to this teen's bedroom. And this mother has this immaculate bedroom. It looks just like any teenager's bedroom. And except for there's a pack and play, there's room just for her twin bed and a dresser. And so the home visitor sits on the floor. I sit on the edge of the bed, and this 6-month-old baby is between me and this young mom. Dr. Miller probably was her doctor in all actuality. But this young mom was so excited to share with her home visitor all of the books that she had been reading to the baby that since their visit the last week. And she showed her a toy that the home visitor had taught her how to make out of things that they had there in the home. And the pride and joy that this young 16-year-old mother had was just incredible. That's the work of home visiting. That's what we're talking about today. That is parenting education. And it's what we call infant mental health. This is the beginning and the foundation for kindergarten readiness, for third grade reading, for high school graduation, and for employability later on in life. So you're going to hear me talk about that. It all starts at day one. And I'm talking to the choir right now because you all know, much of this. So, and many of you are very familiar, Sue, with relief nurseries. And I know many around this table understand a lot of what the relief nurseries do. So I won't spend a lot of time, but I do want to just if you can show my slide deck. I don't know if those are ready. I just want to talk with you just a little bit about what is a relief nursery. So relief nurseries are homegrown, and I'm on slide 2. We are homegrown here in Oregon. They originated in 1976 in Eugene by Relief Nursery, Inc. And over the last 4 decades, the model has grown both in its spread, but also in its impact. It's a model that wraps around families and engages in community volunteers. Our last count, we had more than 125,000 volunteer hours annually to support children and families in our community. So relief nurseries really try to engage the community in being a part of what's happening around the state. And so as you can see on this map right here, we have 16 nonprofits operating relief nurseries in 38 sites, and that's 38 different communities around the state. We touch about 22 different counties. We have 4 new relief nurseries under development right now, thanks to some private funding that they were able to secure. Annually, we serve right around 2,300 children and 1,700 families. And all of those families are getting home visits. 41% are children of color. And 45% of our families live in rural or frontier communities. So that gives you a little bit of an idea of who relief nurseries serve. 5 of my relief nurseries also hold the Healthy Families contract. So we are very aware of what it takes to run both a relief nursery and a Healthy Families program. One of my relief nurseries also operates the Early Head Start for Marion County. And they hold a variety of other contracts. 9 of them hold the Family Support and Connections contracts. So we are in homes, in families, and this is really the lifeblood of how we see ourselves. So go to the next slide, please. So I say that we have a big impact on little lives, and this can be said of, this is what home visiting does. This is a relief nursery statistic from an annual evaluation or biennial evaluation that we do, but as family building blocks will say, we're doing the work of keeping children safe and families together. This is all home visiting programs are child abuse prevention programs, whether it's Nurse Family Partnership, Babies First, Cocoon, Family Support and Connections. We are all doing this similar work and working together in what I like to think of as a ecosystem of home visiting programs. So this next slide, I'll just go real quickly through this, but I know that every home visiting program has different funding streams, but this is what it looks like for the relief nurseries. So from before the time of the Commission on Children and Families in 1994 through the creation of the Early Learning Division Oregon has invested in home visiting and in family-centered services. I looked back on the early Commission for Children and Families and some of the same objectives that they had in 1994. Some of you were there, are some of the same things we're talking about. They hold true. Invest in families and you invest in Oregon. Let's go to that next slide, please. So looking at what is working in Oregon, the first thing that I want to say is give a huge atta girl or atta boy or atta us to creating a home visiting committee. We're very happy to see this committee take shape under the Early Learning Council. And we've definitely felt the deficit since the sunset of our Best Beginnings Committee. But more recently, we've also seen a lot of success in the Home Visiting Model Collaborative. We meet 6 times a year. We used to meet every other month, having breakfast, getting to know each other's home visiting model, and really trying to do what we can to help elevate inter-model collaboration. And during the pandemic, we met all the time to figure out how do we give guidance to virtual home visiting. So this is part of what we are doing. We also, like Shauna talked about, that model flexibility of having a public and private partnership. We have some of that flexibility. If a family needs 2 home visits a week, we do that. If they've moved to monthly home visits, we can do that as well. And I think some of you have been around to the growth of relief nurseries across the state. Since the Student Success Act came to fruition, we have increased 10 new relief nurseries since 2017. So we're excited to see that growth. It is not without private investment. It is not without that public investment working together. But we've also, through SSA, seen the expansion of Healthy Families, Nurse Family Partnership, and Early Head Start. So I think we're still adjusting to what that means out in the communities. Enrollment coordination is one of those working / not working. I think it depends on who you talk to. And that goes back to these decisions around enrollment need to be community level decisions. How does coordination around enrollment work in Multnomah County? Well, it's very different than how it works out in Wallowa County, I would guess. So we need really those decisions and the ways that enrollment happens to be funded by the state, but actualized and coordinated in community-based systems. And then the last one, I will just say, relief nurseries pay roughly $100,000 annually for the ability to own and operate a private database. This has given us a lot of flexibility to have a statewide program dashboard where we can see, we can track service delivery, we can monitor program quality, we can better understand, at least from my desk, the impacts and scope of services to families. And I would say that strategy 1.9 in the new plan may want to consider inclusion of the ORN data as part of the shared systems. We have a contract with ICS. We worked on that contract, so ICS will have us as part of their data every quarter and will allow us to be in the OCID database as well. But I think that this would be a natural next step for us, which probably would be more of an activity than a strategy. So my last slide is, my colleagues have talked about recommendations. My first recommendation is keep doing great work. I looked over the plan and like Maria said, man, you guys are nailing it. So I just want to give kudos to those that have worked on the plan. I read through it and I'm like, oh yeah, that's already there. And the work that the home visiting task force did, their recommendations, we fully support those recommendations and appreciate being included in those. My recommendation 1 was to maybe elevate goal number 2 to goal number 1. As you know, first 1,000 days of a child's life are the most critical. So I'm curious of what it would look like if all families with children are supported to ensure their well-being was the number one goal. Perhaps it's not an order of importance, but maybe it makes a difference when someone sees the first goal on our plan is children and families. And then research support centered on home visiting. I know there's been a lot of work done around research, and the creation of Elmo has been such a fantastic tool. And I believe that something like that, something akin to Elmo, the next step would be what's the capacity for home visiting in that area, and how do we differentiate between preschool and home visiting and parenting education. I think all of that likely will be part of what the activities will be in the next 5 years. But I would really love to see more research happening around how are we doing? How's the relief nursery model impacting families from all kinds of backgrounds? And I'm sure that, and I've read that is a huge priority, having both the funds and the intent to research programs. The second one is just this parent and caregiver centered enrollment strategies. When I reviewed what parents were saying in the packet that you guys received earlier, I noticed one parent said, we don't even know what programs are out there. So how do we know? So this goes back to marketing, right? And marketing is one of those things that you think, man, why are we wasting time on marketing? But marketing is what changes opinions. Marketing is what gives people access. So I would encourage, anything that we can do to develop universal access to some marketing and messaging platforms. Let's see. So I talked about community-centric enrollment strategies. So I won't go into that anymore. But the one thing that I wanted to leave you with is how can we coordinate expansion planning? Sometimes I have to reach out to my colleagues at Healthy Families and say, wait, what are you planning for 23, 25? In what community, and how many slots do you have? And of course, relief nurseries emerge and develop a little bit more organically, but we want to be coordinated for sure. And we want to figure out where we can stand up services and where we just can't. And having that coordination together, as Shauna said, we've seen a sample of what that looks like when you do statewide coordination. I think that could happen around our home visiting programs, inclusive of all of the models that are funded through various funding streams, whether that's private, the equity fund, OHA, or DHS funded home visiting. And the last thing that I will say is just looking at how do we continue to diversify funding sources to expand capacity? We're trying to de-silo. It's so hard to de-silo funding. And we know that ODHS, I've worked pretty closely with their team around the Family First, around the family preservation. And I think we're starting to see, we've been starting to have conversations about how can we get more home visiting as part of the family preservation work that we want to do when we want to move funding and move all of our efforts into keeping families together, keeping children safe. Because we know the research is very clear that investing early, investing in strong families is where we see exponential return on investment, and it's just what's right for children and families. So I leave you with that. I thank you so much for including relief nurseries as part of this. To be on a panel with these two colleagues is pretty phenomenal. But Sue, I want to hand things back to you for question and answer.
Thank you, all three of you, for fabulous presentations. Wow, there's a lot of exciting things happening in this state, and we frequently don't see those in the headlines. So it's always encouraging to hear from people who are on the ground and doing great things. So we'll open it up for questions and comments, discussion, whatever council would like to say or do. Ali?
Well, first of all, I want to say, if you ever find yourself in enterprise, I had the opportunity to see Maria's program firsthand. It's pretty incredible. I feel like she's running a health department and an early childhood center and an alternative school all in one place, but it is incredible the work that is happening there. So just wanted to give a shout out to her and her leadership and the work of that community. My question was really and I've also had a chance to visit a number of the relief nurseries, which are also, I think they should be a baseline model for how we support children, period. So that's a whole nother thing we could explore at some time. But my question was for Shauna and OPEC. I was just curious, how much do the OPEC hubs intersect or interact with the early learning hubs, and what does that look like?
Great question. And so actually there are quite a few OPEC hubs that are one and the same with early learning hubs or share the same backbone. The majority do now. I was counting them up the other day. I think there were 6 that were not at the same backbone, but ultimately the rest are. And it looks different in different communities. In some communities, the coordinator for the early learning hub is also the coordinator for the OPEC hub. And so they stand hand in hand. They are essentially one person or team that's wearing multiple hats in those roles and looking at really how to intentionally blend and braid those initiatives or teams that are working together on that. In some areas, they are at the same backbone, maybe different teams and working together in different ways. In some communities, they sit in different locations and are very closely working together. They share funding, they co-host events, parent cafes, and others. And there are a few that we are working on helping strengthen the relationship between, where there's a lot of area for growth in that. And so it varies across communities, but I would say the majority are either co-located and have strong relationships between them. And that's an area that we're really trying to build and support.
Thank you. So
thanks for the question.
once I want to tag on to that, and then Peter will go to you. So Shauna, is sharing professional development and staff training, is that kind of an integral part of the OPEC Early Learning Hub partnership?
So yes and no. I would say right now the OPEC trainings there's trainings that OPEC hubs are able to engage in locally in terms of funding support for that. We're providing statewide support that's both remote as well as then regionally. A lot of that support is specific to parenting educators. And so it depends on the type of staff or the type of roles each hub has, whether or not they would be engaging in that. But then we also are providing quite a bit of professional development specific to engaging families, family voice, diversity, equity, inclusion, anti-racism and belonging, facilitation skills. So we're trying to also look at what are the professional development opportunities we could host and bring that span both of those sides. So yes and no, in that some of the training is really specific to parenting education facilitation and curricula, and some is broader, and we really do invite the early learning hubs to participate in that with us.
Okay, great. Thank you, Shauna.
Thank
Peter.
Yeah, so my question is along the same lines. I was taken by the information that was provided during one of the committee hearings about reflective supervision and how important that was to frontline staff. And I had the chance to talk with our relief nursery director just yesterday about reflective supervision, what impact it's made on the Family Nurturing Center. They've been able to maintain staff, they've been able to expand staff, which has been great. And she was talking about the kind of the challenges to kind of spread the effect of reflective supervision to other agencies. And I was just wondering if there's any discussion, or it's along the line of Sue's question too, is there a role for OPEC to kind of say, hey, can we set up a regional reflective supervision training? Is there a role for OPEC to do that, or is that something that needs to come from the ground up?
And I don't know, Kara, if you have any thoughts on that too, if that's a space that you've been in. We have done a couple of things in partnership before, or one specific one I can name, that we host a parenting educators conference in May on campus here at Oregon State, that this year it'll be hybrid, that in the past we worked with a home visiting workforce coordinator to have a track that was specific to home visitors and blended in reflective supervision trainings there as well as others. We were sort of in conversation before that individual left her position around other ways we might be able to expand in that direction. So I think there is potential there, there is interest there, but nothing more concrete than that at this time. Kara, do you have other
I do have some thoughts. We're in this reflective supervision space quite a bit. We Ford has funded us to be able to offer reflective supervision groups for our program leaders. We also work directly with ORIMHA, Oregon Infant Mental Health Association. And so Erin, forget her last name, is the new executive director for ORIMHA. I would say that between Portland State and ORIMHA, and I just met with Dr. Sherry Alderman this week regarding some of these topics in infant mental health. But, you know, there's two things. There's training and reflective supervision. Healthy Families does a great job. They have a good training in reflective supervision. It is proprietary. So it'd be great if the national office would let us share that. And then there's but ORIMHA, I think, would be the agency to help stand up with perhaps with support from Portland State's infant mental health program out there of training around reflective supervision. The second layer is where we're in a crisis right now, is that we don't have enough reflective supervisors. So there's an endorsement that you have to have.
Right.
It's messy. I won't get into the weeds of it, but I'm definitely, and I know the weeds of it. And I think it's one of those issues that needs, it needs money, it needs workforce, and ORIMHA. I don't know if ORIMHA is in the plan. Just strikes me, it might be good to look at where in Raise Up Oregon does the Oregon Infant Mental Health Association and endorsement around infant mental health fit. I didn't see that right away, but I think that would be in providing virtual reflective supervision. We've been doing that for 3 years, and it's been a lifeline for our program. So yeah, happy to answer more questions about that, but
that's very helpful. That's very helpful. And, in the CCOs also have the work that they're doing on the social emotional metric. And if a case can be made that ORIMHA, which I hadn't heard of before, thank you for letting me know ORIMHA exists. If that's a resource that the CCOs could also look to supporting and expanding their work capacity, that might be very helpful.
Yeah, good, great point, Peter. That it definitely could be.
Just on that. Hi, Kara, Shauna, and Maria. This is Ann Kubish from the Ford Family Foundation. It's so nice to see all of you. We've worked with all of them for so long, and they've taught us so much. But on that last point that Kara made, we actually supported a whole cohort of people in Douglas County to get this mental health endorsement, and it has been a resource that just keeps on giving. Even I don't know how many it was, but maybe 12 or 15 or 16 or 18 or something like that. It did. I mean, just that made a huge difference in our little county of Douglas County. Yeah,
That's a lot.
yeah,
Does that mean
exactly.
you want to expand funding to all?
Well, it's worth having the conversation about that.
We're all ones.
But I'd like to go back to this point about the questions that were posed about sort of our OPEC hubs and early learning hubs together and doing this, and just to reflect on what Maria was able to share. And this is one time when being rural and being small actually helps, because Maria is everything in Wallowa County, and she is sort of a teacher, early childhood education, OPEC, all of the things that we're talking about in one person and in one organization. And it's just phenomenal. And that's great. And where we can do it, we should do it. And I guess we do know that there's lots of other places where they're not in one place, or maybe they are even in one place, like an ESD, but they're not even coordinated within their space. And so the question I guess I have to all of you who see this sort of local coordination problem is what kind of lessons, what kind of advice do you have about how we can sort of make that coordination happen at the local level when it's not all sitting in one person named Maria Weir?
I'm going to jump in on that because ironically, first of all, hi, Callie. Ironically, we are not our early learning hub. Kelly Poe and the Malheur ESD run our early learning hub. And I'm thankful for that, but we do coordinate a lot. So every OPEC hub has to have an advisory committee. And so because my BHF board of directors is all from Wallowa County, we use our early learning hub advisory board, and they are the same as our OPEC advisory board. I'm actually the chair of our early learning hub advisory board. And so I make sure that OPEC is on every agenda. The cool thing about that is a 3-county early learning hub, there's leaders, there's 5 from every community there. So it's really an effective way to kind of cross-pollinate by having that connection, even if you're not under the same roof. In fact, I'd advocate for us, it's worked better to not be under the same roof because more people are getting the OPEC message. We partner together on a lot of things. In fact, everybody right now has a focus on parent engagement. And so the Early Learning Hub and our OPEC Hub are combining our parent engagement efforts, because in these really small communities, it's like the same parents over and over again sitting around the table. And so just tonight, we have a Raise Up Oregon listening session for parents that we're co-hosting between the Early Learning Hub and our OPEC Hub. Basically, they're going to do the listening, they're going to present the agenda, but they needed the OPEC Hub to bring the parents to the table because they don't have their fingers in the parent population. So I do think having shared leadership, if not the same leadership, is important. And then having a shared advisory body is another way that groups that aren't housed in the same location could better coordinate their systems.
Thank you very much in advance for your work on the parent engagement, for feedback on Raise Up Oregon. It's something the council is very interested in, and obviously our staff is as well. So thanks, Maria.
Well, and thank you all. I didn't know who was all going to be in this room, and I kind of wish I would have traveled and been there to have lunch with y'all.
Oh, we wish you had too, in spite of the snow or whatever. Yeah.
No time for one more question.
Oh, sure. And Subin.
It's okay. It's okay. I was gonna ask a very nerdy question.
Oh, okay. We don't have time for.
Yeah, we don't,
but we have
yeah.
time for.
No, it's okay.
You want to go one level up?
No,
about that?
no, it's
Good.
fine.
Okay.
Well, my question is kind of based on what Shauna, it was for everyone, but how you opened in your storytelling about behaviors. I wondered what the intersection is of all the groups with IEESE and like children in sort of that special needs space, because families need support. And I know that there's some brokenness in terms of getting families what they need, getting schools what they need, both on the early childhood side and like in kinder first. And so I'm just wondering how you intersect with the IEESE space in your respective work.
For us, a lot of that work is happening at the local level directly with hubs in partnership. We're also hearing this tremendous need in the parent and family leadership and parent and family voice work, that is a critical need that families are asking for. Those who are standing up as leaders in their communities often are saying, we would like advocacy skills. We would like to learn how to go and speak to our local school board. We'd like to go and speak to legislators. We would like to be advocating for funds because our children do not have their needs being met in schools right now. And so we're seeing both increased attention to local partnerships as well as some asks coming out at the state level. And this is one of the areas where, as we're looking at increasing funding specific to parenting ed programs, to look at how do we also bring in more specialized curricula or groups that really are meant to meet families who have children with disabilities, families with special needs, or who are looking to really connect and grow specific skills, whether it's around advocacy or needs of their children in community with other families who understand.
Okay, I'm gonna ask my question. No, we're out of time. We're out of time, right? We're out of time.
Yeah.
It's okay. It's okay. It's
We always run out of time.
okay.
We're
I'll
also
e-
happy to follow up with email.
I'll
or
email you,
another
yeah.
way.
Okay. And I know Kara had to drop off because she's heading up another meeting. But Shauna and Maria, I want to thank you very, very much on behalf of the council, but also I just heads up. The Raise Up Oregon plan right now, as you know, only goes down to the level of strategies. A next phase of this is going to be going to the actions under the strategies. And so I would just ask each of you to be, and we talked about some of them today, I think are really actions to implement the strategies. But I just throw that out. So as you have your family listening session, Maria and Shauna, as you are involved in other family engagement, if you can help us start filling in the action section of the plan, that would be a huge gift to all of us and to our staff. So just do a heads up, that is coming. So thank you both very much. And we appreciate all that you're doing in your communities as well as for us at the state level. If you see a place where this council, and one of our strengths is that we have 6 agencies sitting on the council with us. So if you see places where we could help in sharing information and engaging our partners in this important work, please let us know that. We are at your disposal. All right. Thanks very much to both of you.
Thank you.
Thank you.
All right.
Yes.
All right. Bye, you guys.
Bye.
My colleague Robin Hill Dunbar was listening to me and she wrote me a correction. We have supported the ARIMA training throughout all of rural Oregon. 100, we've been 100, more than 100 people have been in rural areas have been endorsed. Plus there's 50 professionals who've gone through the infant mental health graduate certificate, which is a step in the endorsement. And the one that we did in Roseburg was quote unquote fully loaded with education endorsement and reflective supervision. But we're trying to do smaller cohorts right now that are similar, focused on BIPOC and tribal populations. So is that all? So that I should have known.
I should market that more.
Wow.
Yeah.
Thank you.
I asked her.
Yeah, thanks, Robin.
I asked her if she put something together so that we can share it.
Yeah.
Because if this is, if this is something that's new
That's
for all of
great.
us, we should learn about it. Yeah.
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 Wow, those numbers are very impressive.
Yeah. Look at us. Look at you. Look at us in rural areas.
Yeah, we should go back through the tape of this meeting and see how often has Ford Family Foundation been mentioned.
Oh. No,
It's
it's
been in
no, it's
most of our
like,
conversations.
Just think about how, I mean, look at these fabulous leaders we have in our state. I mean, Khalid, Peter, the 3 who were just on the 3, and Angie. I mean, it's just incredible.
Yeah. We're very blessed.
Teamwork is doing work, as they say.
Yes, exactly.
All right, well, believe it or not, we are only 5 minutes behind now. This is a record. So,
There you go, Chair.
Jordan and Kayla, welcome back. And I think we start with them and then go to Lindsay, right, David?
Yes,
Yeah.
according to the agenda, yes.
Oh, thank you, Angie.
You're welcome.
Yeah.
All right. ERDC, let's see, what's that stand for? I know I've heard that before. Okay.
You guys are in an infectiously good mood. I feel lifted coming.
In the
Like
room.
I'm not even there.
We got slap happy at this point.
You guys have like a post-lunch bliss going on. All right, we're gonna get into it though. Back into the ERDC rabbit hole. So just want to do a little overview for folks who are either joining us now or who will just be watching this segment on the recorded piece quickly on the sort of framing components that Jordan went over in part 1. And then I'll hand it right back over to Jordan to discuss the actual meat around application process and decision notice concepts that are included in the rules. So Remy, if you'll just take us forward a couple of slides. Just wanted to go over the primer one more time, which is we're really focused on an excision of the ERDC related content from chapter 461, which is ODHS's self-sufficiency program rules. We're taking everything pretty much as it is for lots of different reasons, including systems constraints, the actual volume of the rules that are being moved, and just the capacity of the teams that are doing all of the work to effectuate the migration, not just from a policy making standpoint, but from an operational standpoint as well. So really driving home that it's sort of a lift and shift, as some people like to call it, and less so a sort of like new substantive look at ERDC. Remy, if you'd keep moving us forward. To that end, anything that you see in this sort of presentation or other presentations in the future, you can really assume is status quo, that we're just adopting a policy that's already currently in existence as it is, unless we specifically flag for you that it is new, much like we did earlier with our new definition of categorical eligibility. Remy, if you'll take us forward again. So just wanted to go over that, and then just quickly taking us through the upcoming engagement that we'll continue to do with you and also our community partners, families, and providers. We've got 2 informational sessions starting tomorrow at 4 p.m. and then the following week also at 4. Those are really going over what is ERDC, why is it moving to DELC, how's it going to look differently for family providers and community partners, focusing on the fact that we are keeping everything the same as much as possible to ensure continuity of service, that there's no gaps in families being able to apply and receive benefits, and that there's no gaps in providers getting payments for the services that they're providing to those families. Moving on past those 2 weeks, we're going to have 3 rulemaking advisory committees on the March 9th, the 16th, and the 23rd. The first one is going to be focused on all of the changes that ODHS as an agency needs to make to its rules to repeal ERDC. The next 2 sessions will be focused on what is DELC adopting? How did it pull those provisions from ODHS into a rule set that means that ERDC has a structural and legal framework to continue operating within and by on July 1. When the ELC adopts those rules. And then, of course, on through the months, we have the rest of the presentations with the high level concepts that are included in the rules for ERDC that we'll be bringing to your attention and working through. So that's the primer for those who are tuning in again or, just sort of new here. And Jordan, I'm going to pass it right back to you so that we can get into content.
Great. Thank you so much, Kayla. Okay. So we're going to continue on with looking over the different elements of the ERDC rule set that's migrating over to DELC. So this piece here is around the initial application process. This outlines what someone has to do to apply or reapply for ERDC, and then what the department, or in this case, the Department of Early Learning and Care, is held responsible for when processing those eligibility determinations. Again, all of this should be in your packet as well, so you can follow along there, or if you've made notes or anything there, we can always touch on questions as well. We have a little bit more time in this, this segment than we did the last one. So one part of the application process rule set talks about filing an application. And basically how families can apply. So families apply either online or by contacting the department orally or in writing. Oh, I see. Yes, the note there. Thank you. Essentially that provision has to be completed within 45 days. What that means, actually, we'll get to in just a second, but that has to do with the date of request that's established whenever an applicant contacts the department. This provision within rule is important because it creates certainty about what the state has to consider as an application for childcare, and also when that applicant is entitled to a response from the state and when benefits are effective. Moving on to this next piece here that kind of ties in with filing an application is establishing a date of request. And that is a moment in time when benefits are being requested. So that can be done, again, orally or in writing. Essentially, it's whenever that applicant reaches out and says, hi, I need childcare. The importance of this being in rule is because that once an application is approved, those benefits go back to the first of the month in which the date of request occurred. So if someone requests benefits, let's say today, February 22nd, but they don't complete all of the application requirements until mid-March because they have 45 days to complete everything, and that can be extended if needed as well. But as long as their benefits are approved, those would actually go back to February 1st because of the established, that date of request being established. There's another element of rule here that talks about requests for more information, and that is whenever there is additional information that's needed to determine eligibility. That caretaker or applicant is entitled to that written notice of that need of whatever documentation is still required, as well as the date by which the state requires it, which is typically that 45-day marker from the date of request period. This element of rule is important because it, again, creates certainty around kind of what is expected between each party, the applicant and the state, in terms of application processing and what level of documentation is required. Lastly, within the initial application process, there's a provision that speaks about interviews with applicants. Interviews are required for ERDC in most cases, except if a family is eligible for what's called priority processing. And we can get into that in the future, but essentially every other situation does require an interview with a caseworker, or rather eligibility worker, to go over their application, to talk about making sure that everything on there is still accurate, and then providing additional resources as well. This can be done in person, but typically is done over the phone to be kind of considerate of applicants' work schedules, school schedules, etc. This is important because it's needed to ensure accurate calculation of benefits, that what is being reported is still what is currently happening and reflective of their childcare need. Okay, I think we can go forward.
One thing. Oh, go ahead, David, sorry.
Yeah, well, this rule sets focusing on ERDC because of the one eligibility process. A family could be applying for multiple benefits at once.
Correct.
Yes. And piggybacking off that point, this is not anywhere on the slide, but I think it's really important for the council to hear. The request for childcare benefits, while ERDC is under DELC, because eligibility centers and the sort of virtual eligibility center, which is essentially like a very robust phone banking system, and the storefront offices for eligibility all live in ODHS for the purposes of creating a date of request or actually requesting childcare benefits. It's only considered that sort of application, that request, in those ODHS spaces that are eligibility centers, like conduits for processing eligibility. It is not going to be that if someone comes to DELC and sends an email and says, I need childcare benefits, that is actually a pathway to accessing those benefits in a way that complies with all of the application requirements of the one system and the sort of structure of the rules. And I just wanted to make that very plain because I think it's something that we could easily gloss over, but I do think is important from a transparency perspective for the public knowing where to go and why it's important to go to an actual eligibility processing center, and also just operationally so that the council has awareness of like what it means to apply for ERDC. You still do have to apply in those spaces that constitute one eligibility. Those spaces David was talking about where you can apply for more than just ERDC at the point of entry.
And how do families know they have to go to an ODHS office to apply for this?
So this is what they do currently. This is current practice, and it will remain the same.
Is that a barrier though? And I'm wondering, like community colleges, there are other places where people navigate benefits that aren't like a ODHS. Can they go there?
Yeah, so there are, I think, and maybe Jordan, you can speak to this a little bit more than I can, but there are community partners that ODHS does have contracts with that sort of exist in spaces outside of eligibility centers or sort of brick and mortar storefront offices. And ODHS is actively looking to expand those areas and opportunities. I want to be ginger here on speaking on behalf of ODHS and OEP, but it's my understanding that they're really trying to embrace a no wrong door policy, right? Knowing that we're trying to reduce the amount of barriers to a family looking for state benefits, regardless of which program type. And so I can't answer your question on the spot about community colleges, but I'm certainly I'll take it back and do a little investigation about it. but they are sort of looking for ways to expand those entry points. And Jordan, I don't know if you want to add anything.
Yeah, essentially like what we've talked about in the past, we really want to keep things working and consistent to what exists right now. So any application assisters that currently would help families apply for benefits, that will be the same. The real key here, and I think what we're trying to avoid, is a gap in access to the system, because essentially what needs to happen is that date of request needs to be marked within the system to guarantee that benefits will go back to the first of that month. I think that this could be something we could definitely look at in the future to see about access and what that could look like. But at this point, I think we'd want to leave things kind of how they exist right now by contacting ODHS or application assisters that already exist to be able to establish that date of request. And that can be done over the phone as well or online, just by going in and starting that application process.
So you can go online to start the process. The time you need to go to one of these eligibility processing centers is for the interview.
You don't even have to go in person to those at all. So families can apply completely online, and then ODHS will schedule kind of an interview time, and they usually do that over the phone.
Sue, oh, sorry, please.
I was just gonna say, I'm not suggesting to change what exists. I'm trying to figure out, can we expand so that there's no barrier to access? That's all. So I understand wanting to keep the fidelity of the existing program. I don't know that the program is hitting everyone it could.
I certainly think that is something felt across all of the programs within one. And like I said, I think OEP, Oregon Eligibility Partnership, and ODHS and OHA for that matter are looking at ways to keep expanding the number of doors. I think it's something that DELC over the years is going to have to contend with, of if there's a door that could be opened within DELC. I think right now, currently, there's not logistical capacity to facilitate sort of the timely transfer of information and processing that would be needed to really do the applicants sort of justice in processing these applications.
I guess what I would just sort of throw, and I think there's potential for sort of space post July 1st to engage.
Once the house sale closes.
Yeah, well, once we make sure that the parents are still getting access and that providers are still getting paid on July 1st to engage the one eligibility system and folks, and I think come to the council and talk about what are those opportunities for for broader community outreach. I know, as Kayla was saying, I think that's a conversation they're happening internally, and I think they would be really interested in engaging the council in that conversation.
I couldn't agree more, David. And I'm sorry to sort of bring us down this rabbit hole. I wanted to call it out because I think it's important, and I think, what you all are saying really resonates internally with us too. Is like, how can we make this better, and what are the ways we can do that? So I think getting that feedback and sort of that nudge to keep doing it better is very helpful for us to, put pressure on making sure those conversations happen post July 1. And Jordan, sorry to derail your very.
No, you're totally fine. Do you have any questions around the application process rule set, just the kind of the bird's eye view that we're talking about? Okay, I think we can move to the next slide then, Remy. Thank you. Okay, another very large component of ERDC rules, and really ODHS's rules in general regarding programmatic benefits, is around decision notices. So this is a written notice that families receive, and it is as you might guess, a decision made by the department regarding an individual's eligibility or benefits for a program. So this has certain requirements that are outlined within rule as to what a decision notice has to include. It specifies the date an action will occur, such as their approval, denial, closure, or reduction of benefits. It specifies the reason for that action being taken. It informs the caretaker or applicant of the extent to which they have a right to a hearing, the method and deadline for requesting a hearing, their right to representation, including legal counsel, and their rights to have witnesses testify on their behalf, any availability for free legal help, and then the rules that are kind of governing that action that's being taken. So there's also rules in place regarding timeliness of decision notices as well, that require families to receive 15 days notice before an action is taken. So there are also elements of that within rule to make sure that benefits aren't abruptly ended or reduced, basically giving clients time to kind of digest that information and also act on that to either request a hearing or to make alternate arrangements.
And this is what ODHS does now, right?
Yes, correct. This is existing already for all programs. So ERDC is just one of them that we're pulling over into the DELC rule set, but it will effectively continue as it does today.
Okay. And this may be one of Suben's weeds questions, but do you have any idea what percentage are denied?
You know, I don't have that off the top of my head right now, but we would be happy to gather that information and give it back to you.
Okay, thanks.
Yeah.
It'd just be interesting. Do you have a weedy question, Suben? No.
I always do. I hold a lot of them. I keep them inside a lot. But I have so many.
Thanks, Suben.
I have so many. It's too many.
Acid reflux.
Oh, dear. Okay, anything else, Jordan? And
That is actually the end of these two rules. So if there are no other questions, we can let you continue on your way.
okay, thank you both very, very, very much. We appreciate what you're doing to keep this program up and running after July 1.
Thank you for your time.
Absolutely. Thank you.
And maybe even better than ever. Okay, well, see you next month.
Thank
See you
you.
next month.
Thank you.
Thank
We
you.
know you're regulars. All right, and now we're going to go to Chris.
Oh, it's Lindsay Pearson.
Oh, Lindsay.
Yeah.
Oh, Chris just wrote the memo. Hi, Lindsay, welcome.
Good morning, Chair Miller and members of the council. My name is Lindsay Pearson, and I am the Oregon Pre-Kindergarten Program Manager here at the Early Learning Division. I'm here today to talk about the rule update for our Early Learning Program grant funding process. We're bringing the rule update to you for a vote in your meeting next month for March. The program managers here at the Early Learning Division, I have so for early learning programs, for OPK, Oregon Pre-Kindergarten, Preschool Promise, and the Early Childhood Equity Fund, have had difficulties getting money out to grantees on time. You've seen this issue before when you passed the temporary rule in September, making it easier for procurement to distribute grant funds and awards, as well as update our funding timelines. So we're now coming back to you to make those changes permanent, as well as some other rule language removal that belongs better in program manuals. The changes that we're proposing, that we'll be proposing to you all next month, will create better customer service for our grantees, and then also allow the division to be more responsive to grantee needs and community needs throughout the granting cycle. Some of the examples of what will change after the rule revisions. Application timelines will be pulled up earlier so that providers will receive their funds prior to when services are set to begin, rather than after the beginning of the school year. Grantees will no longer have to reapply annually for grants. We are, setting the stage for multi-year grants, which creates more stability for grantees and also for families. Slots that are forfeited by programs halfway through the program year can be reallocated to the community rather than waiting for the next grant cycle. And the process would also allow us to issue startup funds in a timely manner so that grantees can actually be prepared to start with children on the first day of school. And then last but not least, it's setting the stage, setting the possible stage for movement towards a universal grant application for grantees with multiple early learning program grants, such as large Head Start programs, universities, school districts, and some of our culturally responsible organizations. So we have a RAC scheduled next week to advise on these rules. And thank you, Angie, for participating in that committee.
You're very welcome. I'm glad to be invited.
You're always a So I know that I kind of ran through that a little bit quickly. Please forgive my nervous early learning council speak. But if you have any questions, I'm happy to answer them. And then if not, I will be back next month.
Thank you, Lindsay. And I'd say it didn't sound like nervous speak to me. I think you did a great job.
Thank you.
Are there questions? And we have heard rumors about having difficulty getting money out the door. So we are tuned into that and appreciate the staff also being focused on that. Thank you, Kelly. So are there any questions of Lindsay? I'll just say it's a pretty rapid timeline here to have the RAC in late February. Public comment open March 1, and we're going to adopt March 22nd, I think it is. So this is moving.
Are they actively recruiting for the RAC now, or is the RAC full?
It's done.
It's done.
Yeah. We've been moving through a process for quite some time, actually a few months, maybe Remy, 2 months. We've been talking about it, and then kind of engaging community partners around the opportunity, making sure that lots of folks were getting the application out so that many of our programs could get it out to families, and as many different types of folks could apply for that as possible. We ended up having 40 applications. Is that right?
I was gonna tag on to you,
For a
Lindsay. I know, we had over 50 applications, and Kali, I specifically want you to know that in the suspension and expulsion RAC we did last summer, our consultant sought feedback from the RAC just about the entire process, and the number one issue that the RAC members had was the application itself. So we totally revamped it, and now we have it available. It's just a little form that you sign in, and it's available in 5 languages. So yeah, it's very successful.
Okay, any other questions? All right, thank you very much, Lindsay. We'll look forward to seeing you in March.
Thanks for having me.
Okay,
Bye-bye, Lindsay.
So now, last thing on our agenda is public testimony. We have nobody who has signed up to speak, correct? But we have received a letter in our packets from the Oregon Early Childhood Coalition, I believe, well, and many partners of the coalition. So if you've had time and I had a chance to read it, you will know it's focused on the suspension and expulsion program. And Kali, do you want to make any comments about this?
I think the community is concerned by the delay of getting dollars out the door, and the community engagement process being really important for this to work well. And so, it impacts additional funding. Governor didn't want to include more dollars, even though overall we know more dollars are needed to sort of fulfill what the vision is. So I think it's just the community saying, hey, like, we're ready, call upon us. We want to be engaged. We want to be part of the solution. And yeah, I think people are paying attention to this one.
Right. Well, and it came up in several of the conversations today. So it's obviously it's crossing a lot of different pieces that the council is involved in. So Alyssa told me before the meeting that we will get an update on the program and the program development at our next meeting. So we'll be able to have some follow-up to this very comprehensive and thoughtful letter that we got. So thank you, Dana, I'll bet, for taking the lead on that, my guess. So no other, did we get any other written testimony? No, that was it. Okay, then I think we are done with our agenda. And council members, thank you all very